Congo. Ashebeleza, ashebeleza, ashebeleza. Can't put ashebeleza, ashebeleza. Ah yeah, ah yeah. Congo. Ashebeleza, ashebeleza, ashebeleza. Ashebeleza, ashebeleza, ashebeleza. Ah yeah, ah yeah. Congo. Ah yeah, ah yeah. Congo. Ashebeleza, ashebeleza, ashebeleza njalo. Ashebeleza, ashebeleza, ashebeleza njalo. Hey, 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 hey. Congo. Condomize, I'll condomize, I'll condomize njalo. I'll condomize, I'll condomize, I'll condomize njalo. I'll condomize, I'll condomize, I'll condomize njalo. Ah yeah, ah yeah. I'll condomize njalo. Ah yeah, ah yeah. Condomize njalo. I'll condomize, I'll condomize, I'll condomize njalo. I'll condomize, I'll condomize, I'll condomize njalo. Ah yeah, ah yeah. I'll condomize njalo. Yeah. Siola, siola le pete. Yeah. Masambe no no. Siola, siola le pete.
Lani Tulamdana 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 Manukhalelani
Ixesha lisondele. Ixesha lisondele. Ixesha lisondele.
Sukandakhala
Khala mntanam.
indwezayo
Ixesha lisondele.
amandla
Mawethu.
amandla
Mawethu.
I think comrades we are going to start now. We are going to start. Technology is disappointing us today, so it was our wish that we have presentations, we have the recorded videos being played live, but yeah, unfortunately we are unable to do that. However, nothing has been lost. The struggle continues. Let me take this opportunity to thank all of you for joining this meeting. Today, we are having a national community accountability meeting on key populations. But before we start, I think it will be important that we introduce ourselves here and other colleagues who will be assisting in terms of interpretation. My name, I am Anele Yawa. I am the General Secretary of Treatment Action Campaign, part of the leadership of the PLHIV sector, as well as the Chief Accounting Officer of Ritshidze. I will start from my right. You will introduce yourself, comrade. Then I go to the left.
Good morning, everyone. My name is James Oladipo. I am a senior researcher with Ritshidze and in charge of the Key Populations Program, leading the Key Populations monitors. Thank you.
Good morning, everyone. My name is Londiwe Kuzwayo. I am the Key Populations Organizer. I'm based in KZN. So we are leading the team for the Key Populations. Thank you.
Hi everyone, my name is Thandiwe Mapumulo. I'm the Key Populations Monitor for the Gauteng. Thank you.
Thank you, comrades. And we also have comrades who will be assisting us on interpretation. I don't know whether you have mics, comrades.
Good morning, everyone. My name is Tato Lovaga, and I'm the Key Populations Monitor based in the Free State.
Morning, everyone. My name is Precious Matuse from the Eastern Cape. I'm also a Key Population Monitor. Thank you.
Thank you, comrades. But also, before we proceed, it will be important for me to acknowledge that in the room we have colleagues from PEPFAR, we have colleagues from USAID, we have colleagues from CDC, we have colleagues from UNAIDS, we have colleagues from VETS, we have colleagues from ORAM. I do not know whether is there anyone in the room from the National Department of Health or online. But I know that the Deputy Minister of Health promised that he is going to join us online. Maybe there are some members from the NDOH in the room. No one in the room. Colleagues, today we are having this meeting to give you a report that was done by Ritshidze on services of key populations that was conducted across the country. We are presenting this report on key populations today, a day after the government of Uganda and the parliament passed an anti-gay bill which seeks to criminalize people who belongs into the LGBTQIA plus community. And if they are criminalized in Uganda, it therefore means they will be denied access to healthcare services. It means they will be jailed, and it therefore means they will eventually die. What is happening in Uganda, soon we are going to see it happening in Malawi, in Kenya, in Zimbabwe, in Tanzania, and other parts of the African continent. And we must ask ourselves, is this the Africa and the world that we want? An Africa and the world that continues to criminalize, stigmatize, and oppress the LGBTQI community as well as sex workers. I can say that in South Africa, we are lucky that we do not have these laws which are criminalizing the LGBTQI community. But sex work is still a crime in South Africa. We are living in a country where when a sex worker walks the streets of South Africa and they come across a police and they are being searched, and upon being searched, they confiscate a condom and they use condom as evidence to prosecute them. We are living in a country where two departments of our government are fighting against each other. The National Department of Health is issuing condoms as part of prevention. The South African Police Services is using condoms as evidence to prosecute and criminalize sex workers. We are living in a country where we have centers of excellence that are supported by PEPFAR in some of our districts. These centers of excellence are supposed, or they are meant to provide friendly and quality services to key populations. But the staff attitude that the majority of the key population are experiencing in these centers of excellence is worse than what we are experiencing within our public clinics. And then the question that we must ask ourselves, and this question that I'm asking here, I'm sure Comrade Eva and other colleagues in the room will attest. Last week we had a meeting in Cape Town with the Minister of Health and the Ambassador of PEPFAR and other colleagues from UNAIDS. I asked Ambassador John Kengasong from PEPFAR as to say, when is PEPFAR going to hold the countries they are funding accountable around issues of criminalization on key populations? These countries are getting money from PEPFAR to fight the spread of HIV, to make sure that they put programs that talks to preventative measures. But these monies in some other countries are meant for services that will benefit key populations. Yet they know it very well that being part of the LGBTQIA plus community is a crime in their country. So how are they going to make those services available? How are they going to make that? Is it not the right time for PEPFAR to consider other means and ways to put pressure in these countries in order for the people who belongs to the LGBTQI plus community to benefit access to quality healthcare services by making sure that they force these countries to scrap these unjust laws, because these laws which are passed by countries like Uganda are unjust laws. When is PEPFAR going to put pressure to the South African government to make sure that sex work is no longer a crime? Because if sex workers, when they go on the streets, they will go on the streets without condoms because of a fear of being arrested, it therefore means they will indulge in unprotected sex. And what does that mean in terms of the rhetoric that we normally hear from our politicians about an end to AIDS? How are we expecting AIDS to end if sex workers are forced to indulge on unprotected sex? So we are here today, colleagues, to hear the recorded stories, but also we have a lot of comrades from the key population sector who are here to tell their own stories, who are here to tell all of us what it means to be a sex worker, what it means to be a person who is using drugs, what it means to be an MSM, what it means to be an LGBTQIA plus when you go to our facilities. How often their rights are violated and how often their dignity is being dragged into a mud to an extent where they feel that they are not human beings. And the question we must ask ourselves, is this what our government is trying to resolve on the ground? Is this what PEPFAR is funding on the ground? If not, when are we going to roll up our sleeves and go down on the ground and fix whatever that is a problem? So without wasting any time, I will give to Comrade James to lead us, and then from there, the program will flow like that. Over to you, Comrade James.
Thank you so much, yes. So today we are launching the third edition of the Ritshidze State of Healthcare for Key Populations report. This report was developed using quantitative data collected through a large-scale data collection effort between July and September 2023 across 24 districts in 7 provinces. Additional stories, testimonies, and other qualitative data was collected throughout 2023. A team of more than 175 people who are members of the key population, made up of staff and volunteers, were trained to support the data collection effort, including to development, mobilization, data collection, analysis, and reporting. This year, 13,832 surveys were collected, combining interviews with 2,612 gay, bisexual, and other men who have sex with men or GBMSM, 6,097 people who use drugs, 3,700 sex workers, and 1,423 trans people. All our data collection tools and full data dashboard are available through our website. Today's meeting will contain stories from community members of the prejudice, abuse, discrimination, and hostile attitudes they have faced while trying to use the public healthcare system, including people who use drugs, sex workers, and the LGBTQIA plus community members. These stories are upsetting and can be triggering.
First, we will look at where members of the key population go to access health services. 75% of people we interviewed use public health care facilities like clinics or community health care centers to go to their primary health care services. This compares to 12% using private doctors, 7% using drop-in centers, and to cater specifically the members of the key populations, and 2% using NGO-run mobile clinics aimed at key population. 4% of people were not getting health services anywhere at all. Only 15% of trans people 7% of gay, bisexual, and other men who have sex with men, 7% of sex workers, and 5% of people who are using drugs reported that they use drop-in centers. While drop-in centers do provide much friendlier care and more services that are needed, as we'll see later in this presentation, they can never provide services for all the key populations that we have. First, there are too few drop-in centers across the country to meet the needs of all the key populations. This year, 83% of people that we interviewed were completely unaware of what a drop-in center even was. Secondly, of those who knew about the drop-in centers, the most common factor for them not using these drop-in centers was that they were too far away, and the other reason was that they costed too much for them to get there. Also, for the queer community, drop-in centers are aimed at only gay, bisexual, and other men who have sex with men. So even if there was an expansion of drop-in centers across the country, queer women will still be forced to use health facilities to get their healthcare services. Instead, building accessible, acceptable, quality services with real accountability metrics that meet the needs of the key population within the public health system is required. I'll give it to Comrade James.
The establishment of centers of excellence has been one solution put forward to the Department of Health and PEPFAR, the PEPFAR teams. Basically, centers of excellence are public health facilities that are identified as places members of key population can go to access services. To be workable though, centers of excellence must be more accessible than drop-in centers and offer the clinical services, expertise, transport, and referral pathways that key populations need. Now we move to recorded stories, if we are able to play them.
So because of technical challenges, we are unable to play the recorded stories. So our recommendations goes as follows. At least 2 centers of excellence per district per population group must be established. This means up to 8 sites per district. They must offer the clinical services, expertise, transport, and referral pathways that key populations need. The sites must not be exclusive to one population group, but rather must have additional concentrated expertise, training, and recruitment strategies based on the population group the site is most likely to be working with. Where people live too far away still to access services, resources such like taxi fare, planned patient transport must be made available so that people can actually get to them.
The next group of issues are on staff attitude at the facility. In this reporting period, very few people said that staff were actually nice to them. Only 35% of trans people said staff were always friendly. Only 33% of gay, bisexual, and other men who have sex with men. Only 26% of sex workers, and as few as 17% of people who use drugs. These results are substantially worse than our prior findings in 2022 and 2021. While there are differences across provinces, all provinces performed badly. The Eastern Cape and KwaZulu-Natal performed particularly dismally, with the fewest reports of friendly services across multiple key population groups. People who use drugs face the most unfriendly services across all key population groups in almost all provinces. Clinical staff, such as doctors and nurses, were the most commonly reported as being unfriendly across all population groups, followed by security guards, then non-clinical staff, then lay staff. Many people reported that staff treated them worse after they found out they were a member of key population, including 35% of trans people, 37% of gay, bisexual, and other men who have sex with men, 49% of sex workers, and 71% of people who use drugs. Of those who said staff were not aware, high numbers were fearful that staff would treat them worse if they did find out, including 55% of gay, bisexual, and other men who have sex with men, 65% of trans people, 71% of sex workers, and 78% of people who use drugs. If people are worried about disclosing that they are queer or trans, use drugs, or engage in sex work, how can they be expected to ask for specific services they might want or need? Now
I'm a P-word. I'm also a sex worker living here in Bombela. It's in Kranzeni, in Nelspruit. My health facility is Nelspruit CHC in Kranzeni. I don't think most our nurses are trained to work with people like myself or people who are homeless, because firstly, most of the people who inject drugs in Nelspruit don't use the clinic. They would rather self-medicate themselves. They would go to the rivers, get the wound washed, and take a shirt tied up and tie themselves. And it becomes septic after that, and it's even worse than the first time. So thereafter, it's straight to the hospital. Who would like to walk into a facility whereby before you even enter the gate, the security is already telling you of how you smell like? I mean, nobody would like to be treated like a nothing, even though we, like for us living on the street, we don't have anything, but what we do have is we still have our dignity, we still have our pride, we still have ourselves, you know. And to go to a government facility whereby you expect these people to actually be on your side and to hear it tell you that you smell, that's a sad picture.
They don't treat sex workers well, because sometimes when you come for your drugs and they do counseling and you share with them that you are a sex worker, they will start and make fun of you.
The sex worker, ne? I started Nobandina 2 years. The Senzali business. Now 2 years in Senzali business. Now in the study ARVs. Kodwa ke kwezo ARVs siya-default guys thina sizi-sex workers because asikwazi ukumelana nemini sifolile. Ingaze thina ufumane iipilisi zakho uhambe, or else njengokuba kukho imibutho ethi yasisebenzela ingaske sifumane mobile, yabo ikwazi ukuthini uzosideliverra iipilisi zethu siyazi uba ngemini ethile izawufika imobile. Nathi le nto sithathe sontlambalazo kuthiwa siyarapha sekogqirha xa sifikayo phaa sijongwe ngabantu bokuba nazi ii-sex workers, nazi ii-sex workers. Ayikho mandi loo nto leyo. Nathi kaloku singabantu mama babantu. Jonga uyabona mna ndidifolthile, ndadifoltha 2021. Yabo nditya iipilisi zabantu, amapilisi omntu uba ndayazi ipilisi yanto ethile, buyibekile phaa ndayazi uba ipilisi yantoni na, ndizawuyiba. Ngulowo nolowo onothi uyathanda ulinda. Asithandi ulinda because sicinga ngexesha lozosebenza ibhizinesi yethu. I-mobile clinic ize kwezi ndawo siba kuzo. Asonqeni uba siphinde siyothesta sitsala amagazi kujongwe isifora because yindawo kakade sithanda sisipothi sethu.
In the clinic, they see us trans people as a clown. When a trans woman walks into the clinic, they will all be laughing. They do not take us seriously.
ngale 28 years club teacher ba tsama club teacher ba dumela ka mokgwa ba re thusang go ne batho ba tu especially go ne batho ba re treata ke na medical go phaka ya a ke phaka medical go phaka nene ka di tse ba re file a re fitla di ntho tsa bona re ntho ke package tsa bona re ntho nene a tsaya nna ba blima nna because ke a tsuba ka poketsa ba yabo ba tlo nthuta because a ya tla kana go itse ke ka yona ha ile bona ba phoso ha ba ntreat be a business ko ke mo ba mfang to detail sa ne ha pocket close ne ya fitla sa ne ba mfang peace peace ke di mang ke tsa kgwedi ke a clinic kgwedi ba mfa peace tsa kgwedi fela le madi ka nka ka selemo se seng se seng January ke nka madi ya nne wena bona ke mo o check wena ba hlalosetse before wena o di batla
ngipuma eResmeeting iclinic engibuya ku engijwayele ukuya kuyo intaba clinic nginokufika ngiyolanda ama prep condoms lubricant and then bangitshela ukuthi after 3 months I have to come back ngizobuya ngizothatha amapilisi. Sometimes bayabuza ukuthi why nilalana nabafana, why nenza into ezinjalo, because niyazi ukuthi uNkulunkulu waletha abantu ababili emhlabeni. Be like awu wena musu umsebenzi wakho ukuthi unginike into eright engizoyenza la, bese kangenzela nezenzo acting, bese kangiacte ukuthi stubborn naso, be like singiyasaba kanye neseclinic nenini ehlangana estradini, be like
Sex workers, I would like them to change their attitude. They must treat us well as human beings. The way they treat us is bad. They would make you join the end of the line even if you have come first. If I go to the clinic and ask for pills, they should stop calling us names but treat us with respect. They are there to help us, not to judge us.
Health workers, I don't know what mentality do they need, because of the fact that you are there to help what is in the body, what I'm feeling. You don't have to know which instruments you or way. You are just here to help me because it's my own right. But then for them, the change that I want to see is I like the government to like teach the health workers to be open, man, to talk to us like people, not take us like we're from the zoo somewhere or been taken from somewhere to put into somewhere. I don't know. But then it's the lot that I want to change. It's the lot because of the fact that some ladies are even scared to go to the clinics. They're even scared to even open up to a mobile clinic nurse, because at some point we do need psychology. Each and every one of us, we have been raped. We have been tortured at some point. Where does that goes? We are so afraid to go and open up to someone, especially when it comes to a clinic, because you don't know where that story will end up.
Nna sister ne ke tsubanya ope ka yona ka thuso go clinicing kwa sister batho ba le like sala bona batho ba fella pelo sister ka ke tsela no monya ka thuso ba o ja o be ngwa le bjana wa bona sister banta teng salang go sa bothata wa bona tswana le no le tseba le bo clinic no makelo ala ke ratoya because of ba ntshwara wete le no ke ka tshaba pila ke tsama di clinic that's why ke sa rato tsama di clinic ana sister no ne ke kula ngona sister ke sa clinic ngono ke swa ke go go tsama spetlele vela a ke tungwadise.
We're moving on to the community members who have joined us today.
Morning or afternoon. Mina igama uGhost because I would like to remain anonymous.
I would like to remain anonymous. Good morning, everyone.
like ho na le ntho se e irahala ka nna nako ke ya ko OD hospital ke re ke ilo consulta le doctor ne ke ile for check up e le hore tshwantse ke ye rehab.
I had an incident happen to me when I tried going to the hospital to consult with a doctor. I needed help getting into a rehab facility.
So ntho e irahetseng ko horeng like no hona le nurse e leng hore ne e thusana le doctor, and then like on the next ka mo side engwe ne le room ya hae ya nurse eo e leng hore we are not consulting ka mo hara yona room e.
There was a nurse that was assisting the doctor, of which her consultation room was right next to the doctor's consultation room. However, that is not the room that we were using to consult with the doctor.
So ntho e irahetseng ko horeng phone ya ba re keng pesa ya nurse eo ka re sa le ya timela, actually like na e misplaces ne e sa timela bofelong a jumpa into conclusions ka hore like ke utswitse ya ba nna motho e leng hore ba nsuspecta for go utswitse phone eo pesa I mean.
The nurse had misplaced her handbag, of which they immediately jumped into conclusions, assuming that I was the one who had stolen the handbag. And then the staff started blaming me for it. Thank you.
Sanibonani.
Good day, everyone.
Igama lami Michelle Hadebe ngisuka eThekwini.
I am from eThekwini.
Ngibe nenkinga neclinic kade ngisebenzisa yona eEdington.
I have problems with the clinic that I was using, which is Eddington Clinic.
Bengilanda khona amaphilisi. Bese kuno sister obejwayele ukusebenzela lapha othanda ungithatha indlela eyayingekho right ngoba vese wayesengazi.
This is the same place where I used to collect my treatment. I had become so familiar with the staff. There is one particular staff member who was not treating me correctly because she already knew who I was.
Ebejwayele ukuthi makufika mina abiza amanye amanesi abangani bakhe bayogcwala lapha e-ofisini. Manje wenza ukuhlekisa ngami kanti ngibalalela siso sikhathi. Khona isikhathi ngafika ngaso late.
Whenever I would arrive at the facility, the nurse would then call her fellow colleagues and they would make jokes about who I am and what I am about. There was a time that I arrived late at the facility.
Imali yokugibela ngangingenayo yokufika ngalelo langa ngizolanda amaphilisi ngafika ngenye date. Kwase kwathiwa angilinde eminyango ngoba ngifike late i-date ngayona yami.
On my given date, I did not have any funds to go to the facility, so I went on another date when I was able to. When I arrived there, I was advised to stand at the door, seeing that I had not come on my given date.
Ngase ngalinda ke eminyango, imane ngiyobuza kubona ukuthi manje ngenze njani. Kwaloko kuthiwa ingqondo yami umthetho wami angizwa kahle ngoba njengoba vele kuwumuntu othusha ukuthi nala ingqondweni angizwe. Kwangiphatha kabi lokho ngaduba ngahamba ngabuyela emuva.
When I tried to inquire into the matter a lot further, I was insulted by the facility's staff.
Ngakazama ushintsha esinye iclinic ngiyayoqala ngabosha phansi. Khona ngizokwazi ukuthola medication yami eNanda eSifananda.
I then decided to rather go to another facility. This is where I was reinitiated into the program, and this is where I've been going since.
Kwafika lapha ngaba kwave kwaba besikakhulu lapha ngoba vese neclinic yakhona yayincane. Wangenzela ikhadi yonke into nefile. Ngathi mangibuyela ngosuku lesibili kwathiwa ifile ayitholakali ngiyibeke kephi. Ngathi ngiyishiye la kunina ewindini. Kwathiwa ngihlala phansi basazoyibheka.
Now, there was further problems at this facility, the second facility that I went to. On my second visit there, I was asked where I had put my file the last time I was there. I advised that, no, I left it with the staff member. This facility is quite small and short-staffed, I believe.
Kwaze washaya isikhathi sokuthi kuyavalwa. Ngase ngiyobuza ukuthi manje ngenze njani. Kwase kuthiwa na angibuye ngakusasa.
All Right. I waited there right up until the facility came to a close. I then asked what I needed to do. I was then advised to come the following day.
Ngabuya ngakusasa kwaphinde basho same thing wathi ifile yakhe ayithola kumele ngiqale phansi until ngaze ngashiya phansi yonke lonto ngabuyela eThekwini ngaqhubeka nomsebenzi engangiwenza ngaseke ngahlangana nama organization akwasisonke noTB Care la I met people ke lapho abakwazi ukuthi basithole immobile ngakwazi lapho ukuthi ngiqale phansi ngithole amaphilisi basiphatha kahle until kuze kube manje ngiwadla kahle amaphilisi wami anginankinga ndawo.
When I visited the facility again the following day, I was still advised that they could not find my file and a new one would have to be opened for me and I'd be reinitiated once again. I then decided to walk out of the facility. Luckily, around the place that I work, I came across Sisonke, people of Sisonke and TB and HIV care. They're the ones who were able to get me reinitiated on the program, and ever since I've been taking my medication correctly. Thank you.
Sanbonani.
Good day, everyone.
Okay, ngi sex worker from KZN.
I am a sex worker from KZN.
Okay, mina ngithatha ama ARVs. So last year bengisebenzisa iclinic umzinto clinic. Thina siyama sex workers indawo engisebenzela kuyona iTavern. So njengoba kuyiTavern bonke abantu be community vele basebenzisa baphuza lapho. Even nabo nesi abanye babo bakwazi ukuthi bayosijabulisa khona.
The facility that I use is Umzinto facility. My place of work as a sex worker is a local tavern of which most of the community members go there during their pastimes. This is also including facility staff members.
So mangabe ngiyolanda amaphilisi ngiyagibela. Kuyenzeka ke thina emsebenzini wethu ungabi nayo imali ngalelo langa kubheda ingabekho imali. So ngakwazi ukuthi uhambe eclinic ngoba kumele ngigibelile.
Whenever I need to visit the facility, I do make use of public transport. So sometimes when I don't have money on that specific day, I'm unable to go, then I would go on another date. A few days had passed of me missing my appointment.
Ngaya khona ke ngelanga sengitholile imali mangifika khona ngabamba iqueue. Kule queue engibambile lana usister waloko ngizibe babiza ebabiza engizipha.
When I was finally able to gather up the funds to visit the facility, I joined the queue. However, the sister in charge that was currently conducting the queue kept on ignoring me continuously.
Kwathi mase kufika isikhathi sokuthi ngene ngaphakathi wase yaqala ke khuluma ukuthi njengoba ukade uhleli nje lapha isikhathi kade sihambile sezinsuku zihambile ungezi uzozala into eniyaziyo ukuthi nihambe niyokwenza lo msebenzi wenu yona into ephambili kunina nikhohle ukuthi kumele nithathe amaphilisi ngifuna ukukukhombisa ukuthi abantu abanjenganawe nje mina thina sibenza njani la eclinic uzohamba uyohlala lapha eminyango ukuthi kuze kuvumela kumina ukuthi ungene ngaphakathi.
When I eventually made it into the consultation room, the nurse continued to say to me that what we as sex workers know best is to prioritize our work and not prioritize our health. So I will show you what we do to people like you. You will go stand at the door until I am ready to assist you.
Mase phumela ngaphandle seza kumina lapha sekuyi10 yami. Then bonke abantu esimene nabo la ngaphandle sebeyazi ukuthi mina ngiyi-sex worker.
Now I was standing outside. Now everyone that I was standing outside with, all my fellow patients, now know what type of work I do because of the nurse's sneers.
Usevele seshilo already ukuthi ngiyi-sex worker mina bona bazositreatha kanjani ngoba thina sivele asenze into zethu ngendlela yethu. So okubuhlungu labantu abavele laba yi-community vele nabo. And thina sometimes siyayifihla umsebenzi wethu kwabanye abantu ukuthi bangakwazi lokho ngoba sizele sineyingane siphume emphakathini nathi.
This was quite difficult because sometimes we do not share our profession with everyone. This is a community clinic of which I live in that community now. People around me and people I live with know what I do. We are parents and we would like to protect our children, so sometimes we don't share as much.
Ngagcina ngawatholanga amaphilisi ngalelo langa ngahamba ngawatholanga and angisengisaba nokuthi ngiphindele emuva ngenxa yamahloni ayesengiphethe mina ukuthi vele mesengiqhamuka kule clinic sengiyazi ukuthi ngenza umsebenzi owukuthi.
I was unable to get my medication on that day. In fact, I hesitate to go back to the facility because whenever I go there, obviously everyone already knows what type of work I do and I get judged as a result.
So ngahamba ngawusebenzisa enye clinic ekuyike PS Godberg lokani clinic yelokani yelokani yamasipala. Lapho abanginikezanga inkinga bangibuzanga lutho ikhadi nani bangivulela ifile banginikeza amaphilisi ami base beyangitshela bangikhanselisha kahle kahle ukuthi as umuntu obe defaulter, then what was the reason ukuthi kuze ngidefault. They wanted to know ukuthi story sithini ngabachazela, so bakwazi ukuthi bangisizeke bona. But ngibe nayo lonke ukuthi phela kuya travelwa base bethi khona indlela abazokwenza ngazo ukuthi if ubona ukuthi imali awunayo kukhona imoto nabo abazisebenzisayo ze clinic ungacela noma lift ungene ngaphakathi uye khona kunokuthi default.
But I now use the Scottsburg Clinic. They were quite helpful. They were able to reinitiate me onto the program without any hassles. In fact, they gave me quite a lot of literacy training and helped me to understand what it means for me to disengage from my care. They also advised that on days that I'm unable to come to the facility because of funds, lack of funds rather, I can ask for a lift as there are facility cars that would roam around.
Enye into abangangibuza ngayona i-referral and isiba nenkinga as thina ama-sex workers asisebenza endaweni eyodwa most of the time kuyenzeka.
The one thing they did not ask for me was a referral letter. As sex workers, we don't work at one place. We do travel around.
Besicela udepartment asisize bandla Nkosi yami ngoba usukuhamba nalo ikhadi lakho bayivale indaba yama referral ukuthi ngeke uze uyithole i-treatment just because busebenzisa enye iclinic then ususebenza kwenye site manje na iclinic la eduzane but ngoba awuyiphethe referral ngikwazi ukuthi uthola amaphilisi wakho.
I would like to plead to the Department of Health to rather do away with the whole referral system because of the fact that we change stations or rather places of work. It makes it quite difficult for when we try to get reinitiated at other facilities and they ask for referral letters and we do not have those.
Okay, ngiyabonga.
Thank you very much.
Molweni.
Good morning, everyone.
Last akulonyaka upheleleyo ndiye ndayovizithela iclinic ekuthiwa yiChangane Clinic.
Last year, I went to Changane Clinic.
Bendiyolanda iipilisi zam.
I went there to collect my medication.
Into efike yenzeka i-reception ndifike ndabuzwa bana ndifike ndabuza yile nto kwifayili yam bandixelela uba abayiboni.
Okay. I went inside and then I went straight to the reception. I asked for my file and they told me that the file, they don't see the file.
But basezoyikhangela bandihlalisa ke for ixesha elide.
I was told that they will still look for it. I should sit down.
Kwafumaniseka uba kufike ixesha loba mayivale ikliniki.
It was time for the clinic to close.
Then ndabuyela endlini ndingazifumenanga iipilisi.
I then went back at home without receiving the medication.
Ndavuka engomso ndavukela kwakhona ekliniki.
I then went on the following day to the clinic.
Ndaxelela unesi uba ifolder yam khayifumaneke izolo.
I then told the nurse that my clinic file, they didn't get it yesterday.
So yena uye wandibuza bana why ndingenazo iipilisi bendiphi lonke eli xesha.
The nurse asked me why didn't I have pills.
Ndimxelele uba bendiyokoluka.
I told the nurse I was at the initiation school.
Athi okay uzayikhangela.
She said okay, I will search for your file.
Nakhona ndiye ndaphinda ndalinda ixesha elide.
Even then I waited a long time.
Until kwavalwa ekliniki.
Until the clinic closed.
Ndamka ndiyazifumenanga.
I then went back without getting them.
Kulapho ndiye ndathatha khona unyathelo ndayovizithela ii-reactors bamaze ndikhaphe ndibheke ekliniki.
It's then that I've decided that I should go to the human rights reactors to assist me in this matter.
Siye sahamba ke sabuyela ekliniki.
We then went with the human rights reactors to the clinic.
Nalapho safika sahlala.
And even then we did stay there.
Baphinda bathi basayikhangela ifolder yam.
They even said to us that they're still looking for the file.
kodwa sigoduke singayifumenanga.
And then we ended up not getting the file again.
Ndiye ndaqonda ke uba mandikhe ndibhalele umhlobo wam osebenza ka-rape crisis.
I then wrote a message to my friend that works for Rape Crisis Mobile Clinic.
Ndamxelela ngalo mba wam ungafumani treatment yam kwi-public clinic.
I then told her about my matter of not getting medication at the clinic.
Then ndabavizithela kwi-mobile clinic.
I then went to their mobile clinic.
Wandinika iipilisi zam, bandivulela ifolder entsha.
I was then given medication and they opened me a new folder.
And then bandinika ileta uba mandibuyele ekliniki.
And then they gave me a letter to go back at the clinic.
Xa ndifika ekliniki ndabanika le letter.
I then gave the nurses the letter.
Iyaxela uba ndizabe ndisebenza nabo kwicala lolanda treatment.
The letter states that I will be getting my medication from the mobile clinic.
Kulapho ke khona istaff siye sazama ukwenza intlekisa mna.
It's then that the staff started to have attitude against me.
Ukuba yintoni na wena ukwazi ulinda sitabane ndini kha sithi kuwe ifayili yakho siyayikhangela.
They asked me, they told me that why don't you wait the stabanentini, a way to discriminate people that are gay. We told you that we'll search for your file.
Batsho besithi phuma ke uhambe uyosebenza nalo organization yakho.
They then chased me away and then said, go and fetch your medication from the organization.
Kunanamhlanje ke ndisasebenza no-rape crisis and bandiphethe kakuhle.
Even today, I'm still using the Rape Crisis mobile clinics to get my medication.
Enkosi.
Thank you.
Sanibona ninjani?
Good day, how are you?
Oh, mina ngisebenzisa ikhumbula clinic. Then there was this other day ngiye ku consulta since bengishajwa inhloko.
I use Kumbula Clinic and there was this day that I went there because I had a headache.
Ngafika ku reception ngakhipha statement sami ukuthi ngitengani. Okay, wabuta this other guy lo sebenza laphayana.
Okay. I then went straight to the reception to produce a statement of what did I came here about.
Sekasebenzisa sibongo sami athi nyundu wena ngathi ugay ke.
And then the reception, the admin staff asked me that I can see your name, but it seems that you are gay.
Hayi, ngathi noma ngabe ngigay inkinga ayikho angidinga lokho namuhla.
I then told the staff that even though I'm gay, I didn't come here at the clinic to have a conversation that I'm gay.
Bese waqhubeka nalabe kahleli nabo lapha phakathi sebahleka ngingabeva ukuthi bathini.
He then continued to talk behind my gayness with the staff that he was sitting with.
Wathi ngijoine iqueue laphayana since bengiya ku consult.
Okay, he then said to me to join the queue since I wanted consultation.
Alright, ngaya ke wangixilonga lo dokotela before ngiyangale kuyongena ku dokotela anginiketa lo bengidengako lapha.
I then went inside and then the doctor examined me.
Okay. Kwaba right vele but nayi langifika lapha phakathi wanginothisa ukuthi ngigay.
The situation was right when I was inside the consultation room, but the doctor later on noticed me that I'm a gay person.
Wangibuta ama silly questions ukuthi umuhle kangaka why utenda igay.
He then asked me silly question asking me that why am I gay?
Athi why ngidliwa tibunu ngimuhle kangaka.
He then asked me why I'm using my anus to have sex.
And ngimphendulile ukuthi kuba gay akusho ukuthi sonke lidliwa tibunu noma ngabe ngidliwa tibunu angiketi ngaloko.
I then replied to him that being gay, it's not about having sex using your anal. I'm not here to talk about that.
Ngalekhathi sekungena lo umunye nesi sekathi emzala lo amuhle angaba mkhonyana lo right mara udliwa tibunu.
And then the other nurse came inside and then they had a conversation to say, look at this young man, is so handsome, but the only problem is that he's gay, but he seems to be a perfect husband.
ngibabutile mina ukuthi njengoba ngila eclinic kanti iclinic akusiyona isafe space noma ngabe ngigay or ngenda yini akusiyo space nayo ukuthi mina like ngingaventa kubo ngikhulume whatever nakaseka yenda inhlekiso yami uqhaza kuthini ngibabuta babo babili.
I then asked them both that if I'm here at the clinic, am I here to be made fun of or as a person? I think that the clinic is a safe space for all the people, including gay people.
Waqhubeka akazange wasangicheka nokuthi kumbe inhloko ngishaya kanjani wathi nawo amaphilisi akho and bengifuna amaloops lelo langa akazange amuka ngiwatholile.
He continued with his work, but he never like properly examined me in my body, and then he gave me the pills only. And then I never got loops because I needed lubricants.
Hello everyone.
Hello everyone.
I'm anonymous. I remember once I visited Sunrise Clinic. Actually, when I arrived there, I was treated badly by one of their staff. As I'm a drug addict, I went there for blood test, HIV status check, but one of their staff treated me badly, talking unusual things, saying like you dirty boys, you are full of nonsense, you should go to school. No, which he doesn't know one of my sides. Thank you.
Good day. The name is Kiam Modisa Nkhato. I'm from the Free State and I'm using Hope Clinic. Yo, don't even know where to begin. It's not satisfying at all. The staff at this facility center are really mistreating us as gay people, transgender, the LGBTI community as a whole. The moment you enter the clinic, their facial appearances change. Even if they were smiling or laughing about something, they become sour within an instant when you enter the gate, the moment they see you. So I once did go to the clinic trying to get myself my treatment. Okay, they told me that they do not have pills. I should come the next day. I asked them, how do you not have medication that is supposed to be in the clinic 24/7 as supply is given to you every now and then? They told me that, I'll have to wait because they told me they don't have the treatment. I waited, came back the next day. Unfortunately, I was called Osis Bhuti, names like Hishim, Stabani. They use unorthodox names to call us. Never use our preferred pronouns. They're never friendly. They never smile. Most of the time, it's like they have their depressions or personal problems. They come along with them at work. You would stay the whole day there without them doing anything helping. I'm a talkative person. If the line is not moving, I'm going to ask questions. They would be telling me, who am I to tell them how to do their job? They're at work, and I'm just there for their help. And I'm the one who's in need of help. If they don't want to help me, they wouldn't. So I must just go sit down and wait for them. They would sit in the coffee table, making jokes, discussing us as patients. You would sit there from 8, and then you would register at 1 o'clock. Sometimes you'd leave at 4 o'clock when the facility is closing without receiving medication. And you'd be told to come back the next day. The next day, normally most clinics, if it happens that it closes before you get medication, in the morning, those people, they prioritize them first. Fortunately, with the clinic I use, you're going to have to wait because your date has passed. They'll start with the people of the very date and then come back to you. Forgetting the fact that the reason that you are there today is because they were so slow yesterday that you couldn't get your medication. And of which the problem is they spend most of their time, how can I say it, having fun, topics, talking, chilling, having coffee for an hour. There is no place I've seen a coffee break for an hour. But then they would sit in the coffee room for an hour or so. They open late. They would open at 8 and start working at 10. So it's really, when you think of going to the clinic, thinking I might not get assistance, I'm gonna be called by names. No one is gonna even smile at me. A smiling face actually says a lot to a person. Even if I'm not feeling well myself, but you smiling at me giving me a positive energy could boost me up. But instead, you would come back feeling even more depressed. Thank you.
Hello, everyone.
And Uma Limpopo.
I'm from Limpopo.
Interesa clinic ya Jamela Clinic.
I'm using Jamela Clinic.
Jamela Clinic abayikhomi kahle.
At Jamela Clinic, they don't treat us well.
But some are very rude.
They are
and
always rude.
And they're judgmentally.
They are very judgmental.
And look, we lava something to lubu, and then we lava the police contraceptive pills.
When we ask for loops or contraceptions, they don't give us.
And then by why ulaba the contraceptive pills where or transgender abanyiki the pills for transgender because the pills itaba basati.
When we are asked why are you needing contraceptives as a transgender woman, because you are not a woman, so they don't give us.
And the she and I go at the end of the day I feel because it's really bad kuba ulaba kupfuniwa and then they treat you bad.
It's bad for us because we are there to get help, but we won't get any help as a transgender person.
Thank you.
Thank you.
The next group of issues are on privacy and confidentiality at the facility. Privacy violations are extremely common. In this reporting period, 57% of gay, bisexual, and other men who have sex with men, 61% of trans people, 65% of sex workers, and 74% of people who use drugs did not think privacy was well respected at the facility. These results are substantially worse than our prior findings in 2022 and 2021. These privacy violations include people's HIV status being disclosed, as reported by 29% of people who use drugs, 29% of trans people, and 33% of GPMSM as shown in the table, and 35% of sex workers, or that people's sexuality being shared as reported by 44% of gay, bisexual, and other men who have sex with men. Or the fact that someone uses drugs as reported by 54% of people who use drugs. Or the fact that someone engages in sex work as reported by 35% of sex workers. Or the fact that someone is transgender as reported by 41% of trans people. The privacy violations also include other medical issues being shared either indirectly through more than one person being consulted in the same room, or by staff entering without knocking, or staff members calling other healthcare workers into the room, often as a way to mock or judge people, or even sometimes security guards will check the medicine when people leave. We now move to recorded stories.
It seems like staff kuma public clinic selela like lama population bantu labafana nami too much siyaba disrespecta before sibanika ama services soqale siba humiliate in some stuff like angathi kuthi or abana knowledge. So I think ngiloko lokumele improve nesikhathi if like ngasithi example eclinic kungaya like umuntu loku general population bunguye nemuntu longalaktuke ama key population lo general population batomnaka fast then wena na ufika utafika bokuqala bakubudetele ama question nje la ngasile la unnecessary like kuthi ba try humiliate bind a joke like yeah we're going to be livestock something like usually suke ukuleli room lawo so utshele ukuthi maybe bayi-2 for example akubude uphendule so uyahleka so ubita lo mnye umngane wakhe sebabayi-3 like bakwenza ijoke yeah like la and obvious nebantu labasuke bala ngaphandle because angithi i-queue ibe khona la ngaphandle kwaleli room la uphuma babuka wena bavile konke leyo bakukhuluma la khathi because babenda lokho bayashouta bahleke bamake amajoke ngale ngesimo sakho.
The nurse gave me my pills in front of everyone and said, "We are really tired of you. Who knows, maybe you are smoking these pills. Why can't you just die because you have already killed yourself with drugs? You don't even bathe and don't like yourself." I was offended as everyone was staring at me. Some were blocking their noses while others were taking pictures. I went to the clinic. I wasn't feeling well. Genuinely, it was just a genuine, I didn't know what was wrong with me. And I got there and then I tested. And then those testing thingamabobs, I had 2 strokes. So I didn't know, when you get 2 strokes, what's going on. The one was really, really, really light. So I'm asking the nurse, my light is, so what does that mean? She's like, no, possibly that you HIV. So we must get a confirmation. They do a confirmation. And she did the confirmation and the confirmation came out negative. So I was like, what does this mean? Because it doesn't. She's like, no, you have to take, she gave me this other container. She's like, Melio Kafol, you need to go spit in the container, go home and then come back with your spit tomorrow and then we'll see if you tested negative or not. And then I went home and then I told my mom what's going on. It was on a Friday. I didn't go on the Saturday because Saturdays they don't open. I was going to go on the Monday. On the Sunday, I was out with my friends. On the Sunday, when I came back home, that specific nurse told another lady to tell my brother, to tell me that I need to come to the clinic because I tested negative. I tested positive. And then we went there on Monday with my mom. And then we tested again. And then I tested negative 2 times. And she confirmed it again and realized 2 times. So my mom is asking a question, dude, if you didn't get the confirmation that this person was positive, why would you want to tell 2 other parties before telling that person directly? Genuinely, like on a personal level, we know that being homosexual means there's already, you have so many people and so many things people are saying about you. You know what I'm saying? So if one person is going to make a speculation about your health in such a way, it's going to affect you.
There is no privacy at all. They shouldn't humiliate us in public. They would be shouting in the waiting area in front of other patients and staff asking is it you in the ID? So now everyone knows that you are trans.
Now we move to community members that have joined us in the house.
Morning.
Luthetha uMasande from Eastern Cape.
I'm Masande from the Eastern Cape.
Bendikade ndisebenzisa iclinic yaseDutywa while bendifunda khona.
I used to go at Dutywa Clinic while I was a student in the area, in the community called Dutywa.
So ndandiye eclinic ngolunye usuku ndiyele into edibenisene nento ze-drop. So ndafika kukho unesi oyi-1 plus nomnye ubhuti wayehleli phaa babayi-2 bencokona.
I went to the clinic because I had drop or an STI, and then I arrived there. There was a nurse with another sir. They were busy there just chatting.
So ndangena ke wathi mandithethe, ndathetha namxelela uba ndize ngantoni na, then kwangena omnye kwakhona naye ndithetha.
The nurse there then asked me, why am I here for? And then I spoke, and then the other staff member entered inside to join them while I was talking.
Azanga nokhe, then wavela waqhubeka wathetha nalaa nesi, wathi laa nesi uba mandiqhubeke ndithethe because uyandiva undimamele.
The door was open, the door wasn't closed. The nurse said I should continue talking while she was busy even talking to the nurse.
So ndavela ndaphuma ke ndahamba because akhona nto ndizoyithetha xa bebhizi bonke bethetha bonke, of which ndize apha ngengxaki yam. So bekusebazi unesi uyandihoya ngendlela erayithi then agqiba ayohoya abanye abantu.
I then went out from the consultation room because I wasn't helped enough because the nurse was busy talking to the colleague because now I was there to get helped, but I wasn't given attention.
So that day nami nabheka e-Link Pharmacy, then ndafika ndacela e-Link Pharmacy uba ndizokwenzani, bandinikeza zonke izinto, bandinikeza ne-injection yonke laa nto leyana. So na-right.
I then went to the pharmacy to get help there, and then they assisted me. They given me medication and injected me, and then I was okay.
The other day ndaya e-clinic again ndiyofuna i-loops and condom. Then banika only 1 pack, then banika only i-sachet ezi-2 ze-loops. Ndabuza ke maziphi ezinye because azizukwanela ezi. But ke bona ke abazinikezi aba-e-morphi, ayizo ze-morphi.
I then went to the clinic again to ask for lubricants and condoms, and then I was given a small packet of sachet and 1 pack of condom, and then I asked for more, but they said to me, no, these are not for gay people, but using the word to stigmatize gays, morphe.
So ndahamba ke ndathenga ke i-loops e-chemist kwi-clicks, nathenga ne-condoms, ndaqhubeka ne-program ka-Precious.
Okay. I then went, I went with what I was given to go to home, and then I bought myself lubricants and condoms from Clicks. Thank you.
Thank you.
Sanibonani.
Good day, everyone.
I'm coming from KZN.
I'm from KwaZulu Natal.
Yeah. So ngisebenzisa iPhilani Clinic from local.
I use Philani Clinic, a local clinic.
So last year ngiqale ukugula.
Last year I was sick.
So ngavisita iPhilani Clinic.
I then
njenge local clinic ngisebenzisayo.
I then went to Philani Clinic because it's the clinic that I use.
So ngangena ePhilani, so oqala ungaya unesi engaya kuyena wangibona ngoba nganginciphile. So wathi unesi before angisize funa ngiqale ngiye kwi-counseling room.
I then went inside to one of the consultation. I met a nurse there, and then the nurse asked me, why am I thin? And then she said to me, I must go to a counseling room first.
So ngaya kwi-counseling room. So ngithe ngifika lapha counseling room, ngakhuluma nobhuto ezongisiza, wase yangichazela ukuthi uzongisiza kuzokwenzekani. Kokuqala wanginikeza khona into wangijova ngayo, kwaphuma igazi, wase yangichazela ukuthi uma ugcwala kusuke kwenzekeni, uma kungagcwali kusuke kwenzekeni.
I then went to that counseling room, and then I met another lay counselor there. The lay counselor, they pre and post counseled me, and then showed me the finger pricking tools, also the HIV testing kit, and then told me that if like what's going to happen in the future once the blood was in.
Yeah, kusho ukuthi ngekhathi ke sekwenzekile ku counseling room wangitshela ukuthi ngi-positive.
And then time went by, and then the lay counselor told me that I was HIV positive.
Kuthe ngaleso sikhathi kwavele kwaguludeka lo nesi engangiqale kuyena.
That time we were busy with him sharing my status to me. The other nurse just went inside the consultation room.
And ubuza ku counseling room ukuthi awu kanti ulana bengithi usebalekile.
And then the nurse that was coming from outside, she then asked the person that was testing me that, oh, the person is here. I thought the person just ran away.
So usebuza kuyena ku counseling room ukuthi sithini status sakhe.
And then the nurse asked the lay counselor what was his status.
So counselor sayamtshela ukuthi upositive.
The counselor just told the nurse that he's positive.
So usethi unesi ke uma seqedile lana ucela ukuthi ngiqale ngiphumele ngiphindele eroomini yakhe.
And then the nurse said to the lay counselor that if I'm done here, can I have him on my own counseling room?
Yebo. Sasala no counselor, ukhansela sekunama finish kufana ukuthi si kuma file sibhaleke kwi file. So ukhansela kunokudideka because I'm gay. Kunama list ashoyo ukuthi umuntu ome kanje. So ukhansela usebiza umunye unesi ukuthi come uzongisiza lana. Khona kusizofila lokhu le form yakhe uthi ugay. So asathi sukwenze njani ukuthi usombiza kanjani kuma gender.
Okay, while we were busy, the counselor opened a file for me, and then now there was a section that it was listed there, gay person, and then he called another nurse to the consultation room and then asked the nurse that I do not know where to list this person. The person is saying that he is gay, but I don't know where to list to make pronouns with the person. I do not know where to tick.
So bangifila kwi blog. So sebengibuza ke imibuzo engayithandanga ngoba kwi private private yami. Sebengibuza imibuzo ukuthi njoba ugay ulala kanjani, ulala ushi noma uhi, yabona bangibo.
While I was inside, they then asked me about silly question, asking me that how do I even have sex as a gay person, and then they asked me when, like, I mate with my partner, I am a she in bed or he.
And banembuzo ukuthi uphi uhi wakho, unayo inamba khona bezomfonela ngoba sengitholakala ukuthi ngipositive.
Okay. They then asked me, where is your she or he? Because we want to call the person and disclose your status because you are HIV positive.
So mina ngabatshana ukuthi anayo ifoni futhi akatholakala uke emsebenzini.
I then told them that my partner doesn't have a phone and he's at work.
So kwangiphatha kabi ke lokho ngoba kwase kubizwa umunye unesi ukuthi how kunogay ofikile lana woza khona nawe uzosiza lana.
Nurses kept calling themselves to the consultation room, disclosing my status and my sexuality.
So gibe sengiyaphuma ke sebefilile ilokhuza ifile yami ukuthi sengitholakala ukuthi positive sengizoqala i-treatment. Ngahamba ngayo kulo one nurse ongibizile. So naye uthe be-check la ku file. So naye waqala phansi waba nemibuzo engibuzayo.
They then the lay counselor continued to take my file, and then when it was time for my file to be ready, I then went to the nurse that was waiting for me, and then when I went inside to that nurse, even that nurse asked me silly questions.
And wayesho ukuthi angithi wena ungumfana manje uthandana kanjani nomunye umfana nenze njani nilala kanjani yabo umbuzo esili.
He asked me silly questions that you are a man, how do you sleep or have sex with other men?
So kwafanele ngichaze ngoba ngangigula futhi ngangifuna usizo.
I explained about what is happening about us men having sex with other men because I needed help then. So that's why I've explained myself to the nurse.
So banginikeze amaphilisi ke sengiqedile ngagoduka. So bangithesta ama test TB.
And then they gave me pills and then they also tested for TB. And then they said I should come after 2 weeks.
So okwangidumaza nje sengibuya ngizolanda ama test kwathiwa ilokhuza ama results awekho abuyanga.
The thing that hurt me the most, it was that when I went to the clinic, they told me that my results are not yet back.
So i-attitude ya nesi engangikhuluma naye uyengihlaphazisa.
The attitude of the nurse was very bad. He didn't know how to talk with me. He was very rude.
So ngize ngasizakala esibhedlela ngatholakala ukuthi i-TB yami ikhona ivelile kodwa sengi-right manje.
I got help from a hospital, and then they told me that I have TB.
Sengi-right, ngiyabonga.
Thank you.
But I'm fine now.
I'm fine.
The next group of issues are those on safety and comforts at the facility. The implications of poor treatment, abuse, and violation of confidentiality are that only very few people felt truly safe and comfortable accessing services at the healthcare facilities. Only 7% of gay, bisexual, and other men who have sex with men, 7% of trans people, 5% of sex workers, and 4% of people who are using drugs felt very safe at the facilities. In this context, safe means safe and protected from verbal and physical abuse, verbal or physical harassment, or even the risk of arrest. Similarly, only 8% of gay, bisexual, and other men who have sex with men, 7% of trans people, and 5% of sex workers, and only 3% of people who are using drugs felt very comfortable at the facilities. In this context, comfortable meaning feeling at ease, like you will be treated very well and you will get what you need. Both these results are considerably very worse than previously our reporting period. Now we will move to recorded stories.
Most of the time when I get there, they call me names. They offend me, and this does not make me feel comfortable. Even the nurses do the same thing. If I want to get tested for HIV, they will discuss this among each other, saying, why am I wasting the test when I'm a sex worker? I wish there can be something done there so that we can be getting the same treatment as other people.
Especially for matters pertaining to sexual health screenings, etc. It's not it's not yet a comfortable experience because of the people that man the facilities, in the manner in which they treat queer people. With the stories that I've heard, it like makes it very hard, provided the nature of the information you need to give in order to get the help that you really need. I'm not really comfortable going to the clinic for that reason. For me, it's very important to have people like me in the room who would understand. So I would be a lot more comfortable not talking to an old woman who's from a different generation, or an old man with, their religious convictions, because it's one of the things that I imposed on us in the clinic. Like, usually when they open in the morning, we have to start with a prayer, for example. So that alone creates a barrier when you have to share certain things, because it makes you quite aware of their religious convictions from the beginning, and there's negativity that comes with being queer from a religious or Christian point of view.
When I went to the clinic, the sister that was attending to me was like, Osi or Buti, what are you doing here? And when she get back to the room, that's when you become their topic. That there is a gay guy that looks like a woman. That make you feel uncomfortable because you can see that everyone just wants to see the gay guy that looks like a woman. So when I have to go to the clinic, I always have doubts because they always make me feel uncomfortable.
We now move to the community member in the room.
Molweni.
Good day, everyone.
Ndisuka Eastern Cape.
I'm from the Eastern Cape.
Bendisebenzisa ikliniki ebizwa ngoba kuse-Gateway.
I use Gateway Clinic.
Bendithatha khona i-treatment yam. Ndithe ngenye imini ndimisishe idate yokuyothatha i-treatment.
I go there to collect my treatment, and there was this day that I missed a date to go take my treatment.
Ndithe xa ndifika lajonga ikhadi kwabona uba ngaba andizanga ngedate befama ndize ngayo.
When I arrived, they then looked at my card, and then they saw that I didn't come for the date that was set.
Kwabuzwa why ndingazanga ngala date befama ndiza ngayo ndabaxeba bendingekho bendisezilalini.
They then asked me why didn't I come in time on my appointment date, and then I told them that I was away, I was at the villages.
Bathi ke bazokwazi ukundinceda ngoba bekusuppose uba ndize ngedate ethile ngondiza ngeyam idate abazokwazi undinceda. Ndaphuma ke ndagoduka, ndithe ndisendleleni egodukayo ndacinga ndingekaphuma egeyithini ndizoyaphi ndingayifumananga i-treatment yam.
And then they said to me that they won't assist me because I didn't come on my date. And then I decided that I should go. But on the gate, I said to myself, where am I going without getting my medication?
Ndibuzwe ngu-security uba kwenzeka ntoni, uyandibona uba ndi-confused ikhona le nto indibhedileyo, ndimxelele kuba bendizothatha i-treatment yam andiyinikwanga ngoba ndimisishe idate.
And then the security officer saw me because I was very confused. And then I explained myself that I was here to collect my treatment.
Ke u-security ucela ukundinceda mandimlinde uzawuya pha ngaphakathi uzawubuya nempendulo.
The security then went inside. The security then said to me, he will assist me. And then he went inside and then said to me that he will come back with a report.
Abuye athi mandenze i-drink uzandinceda. Nyani ke ndimbribe.
Okay. And then the security came and then told me that I should give him a bribe. He will assist me. And then I gave the security the bribe.
Nyani ke athatha ikhadi lam aye ngaphakathi abuye ne-treatment yam ndabe ndiyayifumana kanjalo ke i-treatment yam ngokuba ndithethe ne-security, otherwise ndasendigxothiwe ekliniki ndizixeba ndizoyifumana ndayifumana ke ngoba ndibribe security wangena wandazifumana ke i-treatment yam ndagoduka.
And then the security went inside with the bribe that I did bribe, and then he came back with my treatment. Otherwise, I wasn't going to get the treatment if I didn't bribe the security. Thank you.
The next group of issues are on denial of health services. A major cause of concern is that people across all population groups had been refused health services at the facility in the last year because of being queer or trans, using drugs, or engaging in sex work. This is a violation of people's constitutional right to health. In this reporting period, 8% of gay, bisexual, and other men who have sex with men, 10% of trans people, 11% of sex workers, and a staggering 31% of people who use drugs have been denied services in the last year. These figures are substantially worse than the results from our prior reports for people who use drugs, and marginally worse for gay, bisexual, and other men who have sex with men and trans people. Being denied services is humiliating, painful, and an unjust experience to go through. While some people may suffer the indignity of trying to get services another time, others can be pushed out of care altogether. Denial of services vary dramatically across provinces and population groups.
The highest rate of being denied services for gay, bisexual, and other men who have sex with men was in Limpopo, Eastern Cape, and then KwaZulu-Natal. For trans people, this was in Limpopo, Mpumalanga, and then KwaZulu-Natal. For sex workers, this was in Limpopo, Mpumalanga, Gauteng, and then the Free State. All provinces had high rates of denying people who use drugs services, with 62% of people having been denied services in the last year in Gauteng, 40% in Mpumalanga, 35% in Limpopo, and 31% in Northwest. 10% of people who use drugs also reported having been denied access to HIV treatment in the last year. This was most commonly reported in Gauteng, KwaZulu-Natal, Mpumalanga, and the Free State. Denying people their life-saving ARVs put them at risk of getting multiple additional illnesses and even dying. Now we move to recorded stories.
The nurse tested me and it came back positive. I cried and asked her to help me with the medication. She said, "Why do you bother us? Why should the government waste money treating people like you rather than giving the medication to the patients who deserve it?" I felt so humiliated and hated myself. I was crying and begged the nurse to help me, and she told me to stop prostitution because I'll kill people's children with AIDS. She said I disgusted her.
I was sick and never got to set foot inside the facility because I used drugs. I ended up not getting any services and bought myself Panado. I was chased away by the security guard who told me the clinic is not a place for addicts and I should go get cleaned up first.
Mina ngumuntu odla amaphilisi, ARVs. I'm transgender and I'm also HIV positive. So amaphilisi ami ngiwalanda eNothdale Clinic khona la eMgungundlovu. Ngelinye ilanga kwakuyi-date yami yokulanda ama-ARVs ami. Ngakhohlwa, ngadlulwa u2 days ngingazange ngiwalande. So ngathi mengi-check-a ikhadi lami ngabona ukuthi hayibo sengidlule u2 days ngingazange ngiwalande amaphilisi. Then I got up in the morning and went to the clinic la ngilanda khona amaphilisi. Ngafika ekliniki ngabeka ikhadi lami as usual because mofika khona ushiya ikhadi ngaphakathi ekliniki. Hayi ngaqhubeka ngame-queue. Ngathi ngisame i-queue kwaphuma usister ephethe ifayili yami. Ifayili yami yayiphinki, which was wrong ngoba laphayana amafayili ahlukaniswa ukuthi laba they are positive, laba ba negative. So ifayili miyipink, it means you are positive. Kukona lokho nje kukodwa ku-wrong. Then waphuma usister ephethe ikhadi lami. Wathi you wena mahosha ngqingile engibiza ngawo wonke amagama. Why ufika late? Why uqale clinic eyakho? Because this is not your mother's house. Ngakhala khona ulayini. Ngathi mengikhala wathi ukhalelani? Vele ninelala namadoda abantu nenza kanje ngicaze neclinic yenu. Babizwa abantu. Bathola amaphilisi abo baphuma bahamba. Then kwaqhubeka kwabizwa abanye emva kwami. Ngaze ngathi mina hawu sister, mina ngibizwa nini? Kwaphela ngifike before these people asebehamba. Wathi neleyo imisebenzi yokuba umahosha. So uzohlala lapho. Ngahlala lapho. Ngahlala lapho. Kwaze kwavalwa iclinic. And I ended up not getting the medication. Ngisizakalanga. Ngaze ngaya kwenye iclinic ngaqala phansi. Ngathola amaphilisi kabusha. Kwi-mobile clinic. Njalo bengicabanga lento le. Angifuni ukuphindela kwi-public hospital. Ngenxa ye-Nothdale hospital into eyenzeka kimi. Ngavele ngayeka ngaya kwi-mobile clinic ngaqala kabusha amaphilisi. Kwi-mobile clinic ungcono ngoba If umise i-date bakufonela and then they bring you your medication. Kanti kwi-public, sometimes you don't have money to go there, so you'll have to walk. That's why abantu abaningi, they end up defaulting.
When I went to the clinic, they refused me access to ART because I'm a person who uses drugs. I had stopped using my medication and they refused to reinitiate me because they said I would smoke the ARVs. So I was off my meds for 3 months.
The staff know that I am a sex worker and they don't treat me well. Every time when I go there, they will ask me if I have stopped prostitution. They want me to stop because they say I'll sleep with their kids. I do not like what they say to me. I have to lie so that they can help me. If they know I haven't given up sex work, they can refuse to save me.
They never treat me very well at the clinic. I went there around January and hoped that they would help me. They did not treat me well. They chased me away, told me that I am dirty and that I would steal from other patients. I told them I needed help to stop using drugs, but they just chased me away.
They have no time for us. They call us names like paras, especially the security guards. If one of us is sick and you call the ambulance, they will tell you they cannot come to the taxi rank. There are 3 guys that died on the streets last year because we could not get them to the hospital or clinic on time because the ambulance refused to come.
When I came to this clinic, the KDC, on the 13th of July, I had an incident where I was very sick and ill. And I know that I'm a drug user, but it doesn't mean that they have to treat me in an other, not comfortable way like anybody else who comes to use this clinic. There's a lady here. She swore at me and said, "Get out, you para here. You're wasting seats for the patients who are really needing help here." So please, if there's somebody who can do something to solve this problem or maybe change the person who's the leader in the clinic or the staff, please guys, this is not life. Some of us need these polls because being HIV, it's a very hard thing, guys. It's hard to know about it, and it's even harder when you can't come get access to polls and everything here. Oh yes, it ended up making me guys defaults in such a way that I'm sure you can see my hands are, you can see a person is defaulting, guys. You don't, and there was a time where I had to fetch the polls and they said I can't have them until I take my blood test. So imagine me not taking my pills that long until I wait for my results to come back. What do I do in the meantime? How can you not give me my pills when I'm on HIV treatment? Approximately more than 2 months, because I'm a default, like a huge default, guys, in such a way that when I take the pills now, they make me vomit. They've turned into poison in my system now. We all have right to healthcare, and I think we should be treated in the same way. Yeah.
I had a gunshot wound around February and went to Msogwaba Clinic. But when I got there, I got chased out by the nurse. That I do crime and come to them for their assistance when I am hurt. That I should go back to where I got shot and not come to the facility. They said I don't deserve to live and are tired of people like me.
We now move to our community members who have joined us today.
Dumelang.
Everyone?
Nna ke ile Marikana Clinic.
I use the Marikana Clinic.
So the time I went there, it was so packed. So the nurses told me I should stand on the queue. And I was looking for basic things like loop and condoms. I stood on the queue for the longest time until their lunchtime. I waited and I waited. So when it was my turn to get help, the nurse told me they ran out of stock for loops. I was so confused. Hore, how does a healthcare facility run out of stock yadi loop? I then, lucky enough, when I walked out of the clinic, when I walked out of the clinic, I met people from Me First. That's when I got the services. Thank you.
Sunburn.
Good day, everyone.
ngisuka ePhilani Clinic, yona local clinic engisebenza. Philani Clinic is the clinic that I usually use in KZN. I went there when I was still using drugs. And when I got there, there was a long queue. It was a busy day. Usually they use Tuesdays, I guess, as a doctor's day. So when I got there, it was packed inside and there was a long queue. Okay, I joined the queue. While I was in the queue, there was this lady of which I don't know to refer as a health worker or a security. When I was in the queue, she said to me, "What am I doing here, looking like this? Don't I have anything to do, maybe at the rank? Or I should go to the river and bat myself?" Actually, she insulted me with the way I look. I was dirty and everything. I went there because I was sick. I suspected that I have TB because I was coughing. At some point, I had no appetite to eat. I did not get help at that clinic on that day. Waited in the queue for a very long time, approximately 8 to 12 hours, without being attended, being shifted to the back of the line. Every time being shifted back to the of the line, and then I went back home without being assisted. When I got home, they noticed that I'm not okay, and I reported the situation that I faced on that day to them. Luckily, they supportive to me, even though I was that person I was at that time. They were supported to me. They bought medication for me, and then I self-medicated myself. I never got assistance from that clinic. Up until today, even if I'm feeling something, my family helps me. I do not visit the public hospital, public clinic, I mean. Thank you.
Sanibonani.
Good day.
Igama uNkulewa kaMchunu. I'm from KZN Engwelezane, King George districts. So ngiye ngaba nenkinga lapha engiye ngashawa khona umphakathi.
Okay, there was an incident where I was attacked by the community members.
Ngangishawe kakhulu ngalendlela ukuthi I was dehydrated, I was heavily bleeding, and even couldn't walk because babengishaye emadolweni kakhulu nasemaqakaleni ngoba bese ngikuze ngiphinde ngikwazi ukuhamba.
I was heavily injured from the incident.
So ngaya eNgwelezane hospital. Ingasekhaya ngikhulele ngakhona nje, so ayikho kude nala engihlala khona.
I then went to Ngwelezani Hospital, which is very close to where I live.
Mangifika khona ama security kwayiwona angivimba egate angitshela athi ngeke ekwazi ukungenisa ngoba abantu abafana nawo asisabangenisi la ekhaya because bangena ngaphakathi begangi.
I was denied access by the security guards at the gate, saying that people like me are not allowed to come in because they would come in and misbehave.
So ngibe nenhlanhla ke elinye lama security, I don't know if supervisor or what, but uyena owabatshela ukuthi nokumele bengifake ngoba wabona isituation engangikuyona yabo. But wasiyangitshela wasi uzobuna enhlanhla mabekusizile ngaphakathi. Because abantu abadili kahle nabantu abafana nani.
Luckily, someone who seemed like the facility manager at the time saw me at the gate and requested that I be admitted in, seeing that I had injuries. However, he did say to me that it would be quite very likely for you to receive assistance inside because usually people like you are denied services.
Mangifika ngaphakathi ngihlale kakhulu emabhenchini and benginama pains and bengikwaziwe la ngemuva. Yabo.
I was really injured. I had injuries all over my body. I was even stabbed on my back.
So uma iphuma inesi belokhu lipick abantu thini ngize nami ngiliconfronta ngilibuza ukuthi swami kade ngifikile la and angikwazi. Angibuze athi abuze wabuza umunye ukuthi ubani usebenza egate because uyazi thina still no nabantu abaphema amapara ngoba bafike begange then ba expect ukuthi thina sibasize, and lokho kwangiphatha kabuhlungu because okay fine angisho ukuthi kwakumele ngisole reward party Kubuhlungu ukuthi umuntu ezokutshela phambi kwabantu ukuthi uyanuka and uyiphara and futhi ezongitshela ukuthi ngeke aze angisize ngoba mina ngazi ukuthi since kwi-public hospital nami ngine-right ukuya kuyona.
The nurse kept on coming to the waiting area and prioritizing other patients over me until I inquired why that was done. She then asked me who was at the gate and allowed me access, as people like me are hardly allowed access. It was quite difficult and quite saddening for me to have been insulted like that and being called derogatory names in front of other patients.
So ngize ngabuyela emuva ngingasizakalanga till the next day ngakhetha ukugibela cause ngangisaba ukuthi umphakathi usangabuya futhi uzongishaya. Ngagibela ngisuka khona eMpangeni ngeza la eThekwini.
Right. I went back home without receiving any assistance at all. I was still quite nervous about the community attacking me once again. I then decided to travel to another town, eThekwini.
Mangifika eThekwini then cousin wami wangithatha saya ePrince Mshiyeni Memorial Hospital. Masifika khona ay mangiphatha kahle bakwazi ukungidesha banginika nama painkillers ngahamba ngi-right khona.
When I got to eThekwini, my cousin then assisted me to go to Prince Mshiyani Memorial Hospital. This is where I was able to receive assistance, and since then I've been fine.
But because ngiphinde ngangumuntu ogangile ngisabhema kakhulu, after 2 weeks ngibuyele ngihambile ngaya eThekwini emgwaqeni because bengisanenkinga ye-addiction, so kwakumele ngifide i-addiction. Bengengikwazi ukuhlala ekhaya because ngigcine sengibaphoqa ekhaya sengitshontshela bona. Ngabuyela eThekwini ngawuhlala emgwaqeni ngingakayiqaqi itishi.
All right. Because of the phase that I was currently going through at the time, I then found myself on the streets of eThekwini. This happened before my stitches were removed.
So abafezi bengi-advise ukuthi angiye eDington Hospital and babeyirecommenda bonke bethi hayi right bazofike ngoba usiyokhipha itishi bazokhipha nje itishi because kwakuyilezi ngemuva masikuba nala nje emadolweni lapha engangilimele khona kakhulu basi angiye eDington bazofike bengisize khona.
The people that I was with at the time, most of them advised me to go to Eddington Hospital to have the stitches removed. They recommended it quite positively at the time.
But to a surprise mangifika nakuleyo eDington ngizofika ngafica i-treatment ayifani nalapha na cause ngazi mase ngifike nesini inesi la ngitshela straight usibhuti wami ufuna ukuthi ngiqale nguthinti. Into yokuqala ngicela uhamba ongigezela ungishintshele oyigqokile before ngize ngithinte because abantu abafana nawe abakuthi angibathinti ubabuze nabanye abangani bakho emgwaqeni. Lokho kwangenza inhliziyo yami yabuhlungu kakhulu cause mina ngiyena umuntu ojwayele ukuhamba ibhedlela phansi ngokuthini ngangilimele kwakumele ngesibhedlela. So ngabe ukuthi iyona ndlela maybe kusetshenzwa ngayo le ibhedlela noma kwenzeka kanjani.
To my surprise, the treatment there was contrary to the recommendation. When I got there, the nurse, before even touching me, advised that I should go and take a bath and have a change of clothes before she could even touch me. I'm not a person who usually likes visiting health facilities, so it takes quite a lot from me to even get to that point. So to have been treated like that was very disheartening and saddening for me.
So ngithe mangisuka lapho ngathatha omunye wangintroduce komunye ubhuti oyi-activist naye. Uyena ke uzamile ukuthi esasibuyele eDington siyoqaqa itishi but bengingasafuni ukubuyela khona. Then yena personally kwayena ongisusayo itishi.
Right. I then came across a gentleman who seemed to be an activist. He then attempted he advised that we go back to Eddington Hospital so that he could do some advocacy for me. However, because of the treatment that I received there, I refused to go back. He then ended up removing the stitches himself.
So kodwa bengisafuna ukucela kubantu baka Ritshidze no ngicele about a treatment esolwa ama key populations around iKing Cwetshayo ibhedlela zakhona ngathi ngase ziyafana ama key populations zakhona baba indlela abawatreata ngayo bawatreata ngendlela ebhedayo abawaniki i-treatment. So bengizocela cause if ngingapha eThekwini kunenkinga ngiyazi ukuthi ubani umuntu engaxhumana nayo if ngiba nenkinga ku-health facilities, but eKing Cwetshayo akekho umuntu esimaziyo if mhlawumbe ngasipha inamba yomuntu esingakwazi ukuxhumana naye masinenkinga cause ziningi ibhedlela laphana but mawuthi uyezwa futhi mabexoxa zonke ukuthi kunenkinga efanayo cause laphana kusane gap enkulu between umphakathi as a general and ama key population. Ngiyabonga kakhulu.
I would like to plead that a lot of sensitization be done, most especially in the King Cwetshayo district, because there is a huge difference between King Cwetshayo district and eThekwini. There is still a huge gap between the general population and us key populations. We are misunderstood and still are ill-treated. So a lot of advances towards bridging that gap would be highly appreciated. Thank you.
Sanibonani.
Good day, everyone.
Ninjani? Igama nguSifundo ngwaParak. Ngisuka eKZN endaweni ekuthiwa Savannah Park.
I am from Savannah Park in KZN.
Ey'nyangeni ezedlule ngiye ngagula. Ngangiqala ngayitshela ngathi i-flu. Le flu le yayilokhu iqhubeka kwawesi. Kwathi esontweni lesithathu decide ukuthi no man angiye ngiye eclinic.
A couple of months ago, I felt quite ill. Initially, I thought it was just the flu. However, this carried on for over 3 weeks. That is when I decided to go to the clinic.
Oh, mangifika lapha eclinic here njengenjwayelo ngifike ngijoyina uline.
As per usual, I would join the queue when I arrive at the facility.
Ngithe ngisejoyinile iqueue qhamthi ushusi mnye owners lapho owayengazwa ngasekhaya.
Right. Whilst I was sitting in the queue, there was a nurse who knew me from back home who came towards me.
Wathi abaphela abantu ngazoqambela abanika manga asinamali thina lapha.
She then proceeded to say to me, who are you here to lie to again? We don't have money here.
Hey, ngingaphoxa mina ngomuntu esishazwele angiphoxa lento angibasele actually ukuthi awulusisi uthini manje yabo.
I was quite embarrassed by her stances. I'm quite a sensitive person, so that really hit home.
Hayi ngilinde kuze kube 10 yami ukuze ngene endlini le kaNes.
I then sat there and waited for my time in the consultation room.
Mangena ke sifike lapha sisiyakhuluma ukuthi ngize ngani ngiyamtshela ukuthi no mina ngiyagula la kahle kahle ngisole ngazuthi ngine-TB yabo.
Right. During the consultation, I then advised that I've fallen quite ill and I suspect that I might have TB.
Bengizocela kahle kahle ukuthi ngishiye ikhwehlela ke khona ngizokwazi ukuthi ngibone ukuthi ngiyagula or wathi nje yabo nje fethu anginaso nje isikhathi sakho fethu yabo nje ngiyazi ke usuqale lento zakho fethu engakwenzela yona nje fethu ngakutshela ukuthi uhambe eRkhekani ngoba la le clinic la angala ngasekhaya asinawo amabhodlela ekhwehlela socela nje fethu ungiphumele nje ngikwazi ukuthi ngidile nabanye abantu abaserious engazi ukuthi mina ngikho serious.
I then asked that relevant tests be done to test whether I do have TB or not. The nurse then, very uninterested, saying to me that, you know what, perhaps you should rather go to another facility because we don't even have the relevant tests here. Please proceed to go out of the consultation room so someone else who is more serious can come in, as if I wasn't serious about my illness at the time.
So ngaphuma ke la ngisengibuyele ekhaya ngiyacabanga ngizokwenza njani ngigula kanje.
I then went back home and wondered to myself, what can I do next with me being so ill?
So mangifike ekhaya leyothini ugogo athi no kuzomela uhambe esibhedlela.
When I got home, my granny then advised me that perhaps it's better if I go to the hospital.
Ngenhlanhla mangifike esibhedlela ngifike ngiwenze wonke ama-test ngendlela ngwalinde ngathola ukuthi ngenhlanhla-ke ngangi-negative. Kodwa okwangiphatha kabi kakhulu ukuthi what if mhlampe-ke ngagcina nginqena ukuya e-Argekan and mhlampe ngangi-positive, ngakuzoba worse.
Fortunately, when I got to the hospital, the relevant tests were able to be performed, and the test came out negative. Now, what I wonder is, what would have happened if the test had come up? Now, what I wondered was, what would have happened if the test had come out positive?
Thank you.
Thank you so much.
Hello, everyone. I would like to be preferred as anonymous. So I am a bisexual sex worker. So I live in KZN. The other time when I went to a public clinic for my PrEP, because I use PrEP to prevent getting pregnant while doing my job. So when I was consulting a nurse, she looked at my file and she said, "What do you want again?" And I told her that I want PrEP. And she said, "Do you even know what PrEP is for? Because seemingly you do not know. Because you people like you only uses ARVs or HIV treatment." And I was like, "But I don't have HIV." And she said, "How do you know?" And I told her that I checked 2 weeks ago. I don't have it. And she said that's not possible. But she could see the file that it was written negative. I don't know where she took that from. And I decided to just shut down. I couldn't respond to anything else that she was saying. And she said, if I don't respond to anything else that she is saying, then I am not going to get help. Thank you.
Next, we will see how all these issues can push people out of the health system. Where people are not treated with compassion, care, and respect, it is not uncommon that they disengage from getting healthcare services at the facility or stop accessing health services altogether. Staff unfriendliness was the primary reason cited for this, followed by privacy violations. Other common reasons include being denied services and not feeling safe at the facility. Additionally, for some, the fear of people finding out about their sexuality or the fact that they are trans or engage in sex work or use drugs is a key reasons for is one of the key reasons for not using the facility.
The next we will compare the experience at drop-in centers and also.
He told me it was my fault
sorry.
since I use drugs. I'm never going to that clinic again where they treat us like animals.
Whenever I go to the clinic, they always ask, why do I do my job? Why do I sell my body? Isn't there any other job that I can do besides selling my body? I have even decided not to go to the clinic anymore because of the treatment that I get there. Anytime I went to the clinic, I always come back heartbroken because of the way that I'm treated there. Questions like, didn't you go to school?
I disengaged from care because of the embarrassment at the clinic because I missed my appointment. I was accused of smoking the pills and my HIV status was disclosed in the waiting area. I'm scared to go back there and cannot report to anyone because they would not take me seriously.
Next, we will compare the experience at drop-in centers and mobile clinics. As expected, drop-in centers and mobile clinics definitely perform far better than the public healthcare facilities. Overall, drop-in centers also outperform mobile clinics. Firstly, substantially more people reported that the staff are always friendly at drop-in centers and then at the mobile clinics compared to the public healthcare facilities. Secondly, far fewer people reported that their privacy was not well respected at drop-in centers and then followed by the mobile clinics. While this is far better than a public health facility, PEPFAR partners and the Global Fund funded NGOs should examine their ways of working to ensure that privacy and confidentiality is always maintained to the highest standard. Thirdly, again, far more people reported feeling very safe and very comfortable using drop-in centers, and then followed by mobile clinics. However, these numbers also point to the need to review patient experience to better understand how more people could have a safe and comfortable experience when going to get their healthcare services at these service points.
Again, for Center of Excellence to function, they must be friendly, safe, and confidential spaces, or else members of key populations will not use them. Just by giving sites the label Center of Excellence does not suddenly mean that the friendliness and safety at these facilities has improved from how it has been.
Zoom meeting.
Centers of Excellence need additional staffing so that they can function effectively to support and instill culture change within the facility.
So we will shoot straight to the recommendations. But before we go to recommendations, I'm sitting here listening to the recorded stories and personal testimonials that have been given by the comrades in the room. All what the comrades are asking for is not a favor. They are asking to be treated with respect and dignity. And we are not asking much. And as I am sitting here, I am reminded of the words of a great freedom fighter from Cape Verde, comrade Frantz Fanon. Frantz Fanon says, each generation must, out of relative obscurity, must discover its mission, fulfill it or betray it. And as I'm sitting here, I am not in a position to betray the generational mission. You know, comrades, 1998, TAC was formed. When TAC was formed, it was because we saw the number of people of South Africa who were dying of HIV. And we knew that there was life-saving treatment. And we had to use the law and our anger in order for our government to be able to provide antiretroviral treatment to people living with HIV. Today, we've got about close to 5 million people living with HIV who are on antiretroviral treatment. And that is the achievement of our lifetime. But listening to everything that has been said here, the system is making our people to give up. And when people are giving up on treatment, it therefore means we will lose our gains in the struggle. And we are not prepared to do that. Comrades, I am also reminded of over the past weekend, we had a 4 days meeting which started Friday and ended Monday night. The Treatment Action Campaign National Council meeting, where we had provincial leaders from 8 provinces. We were about 62 people in the room. And the comrades from the National Council of TAC were clear. They told me as the General Secretary that they are tired of my noise. I'm making a lot of noise in these boardrooms, and it's high time that we get out of these boardrooms. Firstly, I thought that comrade was fighting But, comrades, now the time has come for us to use our anger. The time has come for us to stop complaining, but use our anger. We are going to the streets. On the 20th of March, Treatment Action Campaign, people living with HIV and civil society, we're going to the National Department of Health in Pretoria. We are going to occupy that building. We want the Deputy President as the chairperson of the South African National AIDS Council. We want the Minister of Finance. We want the Minister of Health. Because we are tired of listening to this. From the 20th of March, we will embark on civil disobedience campaigns in all the districts that we have in South Africa, where we will make sure that in each district where we have problems, we bring them on the table and we want answers on the spot. The only thing we are not going to do is to occupy our clinics. We will occupy their offices and demand answers. Because it is evident that our government does not take us serious. It has been 4 years since we have been presenting these reports and nothing is happening. If our country and our government believes that we've got rights that are enshrined in the Bill of Rights and in the Constitution, the time has come for our government to walk the talk. TAC provincial leadership here in Gauteng next week is having a meeting with unions of healthcare workers, where Treatment Action Campaign on behalf of the public healthcare users is going to engage with the unions of the healthcare workers to make them understand what their members are doing to us as the public healthcare users. Because we as the public healthcare users and the providers, we are supposed to work together in terms of improving the quality of services. Most of us here in this room and outside at community level, we are disengaging from care due to a number of reasons. And one of those reasons is how we are treated by the nurses in our clinics. Is how we are treated by the security guards and the cleaners. Security guards, their duty is around security, not provision of healthcare services. Cleaners, their duty is to pick up the mop, clean the floors and clean the toilets and stop interfering on provision of healthcare services. So, I am calling upon you, comrades. If there are comrades from around Free State, let's go and organize and mobilize on the 20th who are occupying the streets. If you are coming from other districts, go to the nearest branch of TAC and ask them what actions are they planning to take. All these problems that are being raised here cannot go unnoticed and nobody listens to them. I think the relationship that we have with the Department of Health and our government makes them to take us for granted. If it means that the relationships that we have with our government must fall apart, let it be. As long as we know that we will be standing up for our rights and fight against the system. All these people who are ill-treating us in these clinics, when themselves and their families are sick and dying, they pick up a phone and make an appointment to the nearest private healthcare facility. They don't wait even an hour because they can afford to pay for healthcare services. Ours is what is enshrined in the Constitution, Section 27 of the Constitution, that we as the citizens, those who work and live in South Africa, we have a right to access quality healthcare services. If it is in the Constitution that what has been promised to us, if it means that we must go and take our government to court and demand for our rights, let it be. Let's go and fight back, comrades. The recommendation, comrades, are as follows. All facility staff, including clinical staff, non-clinical staff, lay staff and security guards who ill-treat people, violate people's privacy or verbally or physically abuse or harass people must be held accountable and face consequences. Centers of excellence need additional staffing so that they can function effectively and to support and instill culture change within the facility. For PEPFAR, this means district support partners that already employ significant healthcare workforces should redistribute staff to centers of excellence, including specifically recruiting individuals and advertising positions that will have an emphasis on specific key populations within the context of general population services. For the national, provincial, and district health departments, this means ensuring that all centers of excellence staff recognize that their obligation is to provide services equitably across all populations and not as unique cases to be handled by PEPFAR DSP staff.
Now we will move to services that are actually available. First, we will look at the availability of condoms and lubricants. External condoms, internal condoms, and lubricants are basic HIV prevention tools. Yet these tools are not always available for queer and trans people, people who use drugs, and sex workers at the facility. Despite the disproportionate risk of getting HIV if you are among these populations, in January and February 2024, Ritshidze data collected at facility level showed that while 92% of sites had external condoms available and only 75% had internal condoms available and just 28% had lubricant available. This while 64% of sites said they do provide lubricant for HIV prevention purposes. Firstly, lubricants are often associated with people who are members of key populations. Therefore, by asking for lubricant, you could be forced to disclose this. Building on this, secondly, given the limited number of people who reported feeling very safe and comfortable at the facility, as well as those who thought they would be treated worse if staff knew they were a member of key population, if makes asking for lubricant potentially unsafe. While condoms were more available at the facilities, that does not always translate into access. Only 60% of gay, bisexual, and other men who have sex with men and 57% of sex workers we interviewed said they were able to always get condoms. Further, only 50% of gay, bisexual, and other men who have sex with men and 49% of sex workers said they were able to get enough. Only around half of gay, bisexual, and other men who have sex with men and sex workers who wanted condoms said staff were respectful to them when they asked. At some sites, people were even questioned as to why they wanted them. Again, this is a contrary to HIV prevention efforts. For those who were unable to access condoms, mostly this was a result of staff saying there was a stock out. Sorry. Okay. Of the sites that did provide lubricant without having to ask anyone, positively, 25% put those in a private space and 25% were in toilets. However, the remaining sites put them by the reception or the waiting area, or again in the consultation room where they must be requested. Not only can it be uncomfortable to take condoms and lubricant in front of people in the waiting area or the receptionist, so they opt not to. It can also be unsafe or lead to further harassment or abuse. Far fewer being reported being able to always get lubricant than condoms, including only 46% of trans people, 37% of gay, bisexual, and other men who have sex with men, 37% of sex workers, and 31% of people who use drugs. Further, only 46% of trans people, 41% of sex workers, 39% of gay, bisexual, and other men who have sex with men, and 34% of people who use drugs who tried to get lubricant said they could get enough. For those who did ask for lubricant, too often staff were not respectful or questioned them on why they needed them. Another factor that put people off asking in the first place. Access to lubricant across provinces varied, with the fewest gay, bisexual, and other men who have sex with men, people who use drugs, and trans people having access to lubricant in the Eastern Cape, and the fewest sex workers having access to lubricant in Mpumalanga. For those who were unable to access lubricant, the most common reason given was a result of staff saying there was a stock out. Now we move to recorded stories.
Condoms, yes. Condoms you get at the gate. Condoms is like for everybody to see that you are collecting condoms. So it's like there's no privacy for SWs at all. It's like I don't know why is it like that, but that's just the way it is.
I went to the clinic to get condoms and lubricants. Inside, one of the staff members called me Beto, a derogatory term used for gay people, and other patients were laughing. There were only condoms in the dispenser, and when I asked for lubricants, they said they hardly have any. They wanted to know about my sex life. I now buy lubricants and will never go to that clinic again.
Lack of communication, like in terms of like, the posters, are visible in terms of nice gay men. Lack of services, honestly speaking, and then le nax to the lubricant this year, come on. Like let me know, hey sister, you copy this and that. Okay, about whereas o tlo botswa dipotso.
Ke na le dilemo tse 38 a MG. Ke ne ke le lo batla ke tswa clinic ke lo batla dintho tsa rona tsa gate ke tsa ka ke tswa ka tsona. Ba mpolela for ha di sotle. E sa le kgwedi even in le kgwedi. Hape ha ke ya mo ba ga di sotle ba ka nne ya tsona. Ba re ke di ba ka chemistry. Sometimes ke ke tsa ka vaccine.
They should let us take as many condoms as we like, because when you are taking them, they will say, why are you taking so much? What will the other ones use? Loop is not always available. They will tell you it's out of stock.
Okay, it didn't go so far. It's a challenge in Nguyo because misofuna ama weekend asiwathola esikhathini esiningi bese sabanawo stock out like gcina kwami was July nge-23 sithi sifuna ama-weekend bese hey thina sinawo ngapha I can go to Shawela clinic and okay Shawela futhi nakhona is a lot of money sihlala la elokishini si-community la Dikloof okay Shawela mele sithole imali futhi ukuthi sigibele ngcono nje batholele nawo ama-weekend abe la eduze kwethu sokwazi ukuthi singeke sisagibele okay ama-condom bona basipha wona ke akahluphi is the best thing esiyitholayo esikhathini esiningi but lubricant is scarce. I wish nayo misingaba nayo ibiseduze la eLidenguyi. Yeah.
We now move to our community members who have joined us today.
I would like to remain anonymous. As for myself, on last year, it was October, I couldn't go and fetch my tools on the mobile clinic. Apparently that day I was busy. So I took a chance and went to a clinic at Bria. So when I got there, the nurses were too busy, so I waited in the line up until I was assisted. So apparently I took many condoms because I needed them. So when the nurse realized that I had many condoms with me, they asked me, why do I have to take so many? So I explained it to her that I needed them, and I can't be going there in and out each and every time because I have things that I do, so I don't have time every time. So then when she saw that I took many condoms, she started saying that I mustn't take many condoms. There are people who still have to come and take condoms also, so I must only take one box. Okay, when I take the one box, and then she said to me, why I always come to take condoms in the clinics, why can't I buy them? And I told her that I don't have money since I'm not working. So I asked her for lubricant. When I asked her for lubricant, and she started saying, why do you need those? Because they're only used by the girls who are dirty, who are selling their bodies. And I was like, do you even know what the lubricant are doing? What are for? And she started laughing and calling her colleagues, and they were now going on and off about my situation and telling me that if I need lubricants, I must make money and go and buy them for myself and not go to them and ask for lubricant because they don't provide them. Thank you.
Molweni.
Good day, everyone.
Aviwe Sky, Eastern Cape.
I'm Aviwe from the Eastern Cape.
In November 2023, I went to Stanford Terrence Clinic. And ndifikile eStanford ndangena ndaya e-reception ndayocela uncedo.
I arrived at the clinic and then I went straight to the reception to ask for help.
Ndafika kukhona enye intombazana ndacela i-lubricant ne-condom. And bendijongile unjonga kwakhe kuba ndingumntu owesityi drugs.
And then when I went in, I asked a lady that I met there for condoms and lubricants. And then he started there having attitude. The way he had attitude, he said that I was a person that I look like a person that uses drugs.
Ndiye ndahlala namjonga. After ndimjongile, wandithumela kwi-security phaa phandle. Ufika kwam kwi-security, sifike sa-security, hayi wena usebenzisa ii-drugs ndake ndakubona apha etown.
Okay. When I was asking for the condoms and lubricants, and then now I had went back to the security, and then the security said, no, you don't look like a person who uses drugs.
Into bendiyoyifuna phaa bendingayogula bendifuna ii-condoms ne-lubricant for uba uzikhusela mna ndibe safe.
I only went to the clinic to ask for condoms and lubricants because I wasn't sick at all.
Uye wahlala wandishawuta i-security sandixelela uba ndiliphara.
Then the security started shouting at me and telling me that I'm a para.
Ndiye ndahamba ke ndingazifumenanga i-lubricant ne-condom and zandiphinde ndiye kwenye clinic because ndoyika i-harassment abayenzayo kwezi clinics xa ubungumntu obisityi drugs. Thank you.
I then went out from the clinic without getting condoms and lubricant because now it's like when I'm going to the facility, they harass us as a person that is using drugs. Thank you.
Greetings, everyone. I go by the name of Semi Malachi. I'm all the way from Limpopo, Polokwane Extension 76. As a trans woman, I use Beta Clinic. So I feel like at Beta Clinic, they don't treat us the same way. Like they don't treat us like the human beings because I'm a trans woman. I went to Beta Clinic. I was not, I didn't want much. I wanted only the painkillers because I was involved in a car accident last year on 10 September. So when I went there, the attitude started from the gate. When I went there, I gave the security my ID. So the security asked me a question like, are you a man or a woman? I said, I'm a woman, and I would like you to address me as a woman, and I will respect that. And then she's just like, he started asking me questions like, are you a woman? Well, you're still having your peanuts under your legs. Okay. Then I went inside. Then when I went inside, the staff, the nurses, the staff, they treated me somehow because I'm a trans woman. So, as a trans woman, I feel like the DOH should do something, or maybe sensitize their staff so that the upcoming KP should not face the challenges that we are facing on a daily basis. Thank you.
Next, we'll look at PrEP and PEP. Ritshidze data collected at facility levels show that there has been an ongoing increase in the number of sites that say they prioritize offering PrEP to members of key populations. In January and February 2024, 72% of sites say they offer PrEP to gay, bisexual, and other men who have sex with men, 67% to sex workers, 63% to people who use drugs, and 55% to trans people. However, far fewer people reported ever being offered PrEP at the facility. Just 29% of gay, bisexual, and other men who have sex with men, 23% of trans people, 19% of sex workers, and 12% of people who use drugs. Compared to data collected in 2022, our 2023 data report a lower percentage of people saying they have been offered PrEP for most population groups. PrEP awareness varies across population groups, with 83% of trans people we spoke to knowing what PrEP is, 82% of gay, bisexual, and other men who have sex with men, and 79% of sex workers. Yet only 51% of people who use drugs we spoke to had heard of PrEP and knew what it is. It is important that PrEP is actively offered to members of key populations and that people are actually made aware of its benefits in order to make an informed decision about starting. Given that members of key populations likely may not want to out themselves at the facility, given the ill treatment they could face, this can make it difficult to offer PrEP to those people. Other options could support awareness building, like putting posters up explaining the benefits of PrEP, as observed at only 58% of sites monitored in January and February 2024. Or including PrEP as a topic in daily health talks. It also shows that critical role of centers of excellence, which need to create a safer environment for members of key populations that will allow for more people to be offered PrEP. PrEP is another tool that is not always made available. While 64% of trans people told us they were always able to get PrEP in the last year, only 45% of sex workers could, and only 36% of gay, bisexual, and other men who have sex with men. The main reason people were unable to get PrEP was due to stock out. Other reasons including people getting questioned too much for why they wanted it, feeling uncomfortable to ask, or being told it is not offered at that facility. Now we move to recorded stories.
As a sex worker, and I tester, I'm negative 3 times. I test a PEPFAR clinic, and I work a lot. I go swim, but I PrEP. Because we kindness for my sometimes I phone a condom. Yeah, when I come back, man is cosel, and I work along about 2 times. The come and the malin, the clinic, Semalinti. Now for man, at least that's safe. Apple auction session as written the mamelamus. Go PrEP. Bakunda cosele. Go positive, at least no.
I only heard of like the or any way you want to maybe but then enough for more high like first hand person. Ngasimus will be PrEP or again.
Ngahamba ngaye eclinic, ngihamba iclinic estanza 2. Ngathi ngiyile eclinic bengiyofuna iPEP. Bangitshela ukuthi ayikho. Silanana kakhulu. Fanele sizame ukuzivikela. Ngathi ngiyachaza ukuthi why ngizile ngizoyifuna.
but kuzomele sisebenzise ama-condom because siza kakhulu la eclinic and siyabakhathaza. So ngabachazela ukuthi bengisebenzisile i-condom but yabhasta. So bathi ngeke bakhona ukungisiza because into engiyifunayo ayikho. Kwamele ukuthi ngijikele ekhaya because bekungananto engingayenza because bengifuna usizo from eclinic. Bangitesta for i-HIV but yathi negative. Bangifaka erumini bathi the only thing ebanganginceda ngayo ukuthi bangitesta i-HIV. So bangifaka erumini bangitesta bangitshela ukuthi kuzomele sizame ukuzivikela kakhulu. Uma i-queue yabantu bonke like la uyocala khona ufuna i-file. Then from i-file then uyoqueue kune-queue yabantu like ngisho different abanye abagulayo then lethu iyona eyodwa yokuthi ufuna ini PEP. Inhliziyo yami ibe buhlungu because it was a risk. Angazi ukuthi kwenzakalani emzimbeni wami. What if into engiyikheshile mhlawumbe ulwelwe or anything else.
We have one
We
community
now
story.
move on to community members who joined us today.
Good afternoon. My name is Anonymous. I'm from Limpopo, Polokwane. Last year, I went nobody clinic because I'm sex worker and I have sex with client and condom blast. So everything went well. When I'm inside the consulting room, I'm telling the nurse that had sex with client and condom is blast. So I need PEP. They said they can offer PEP for people who selling. They say they can offer PrEP for people who is sex work. So I didn't get a service that I was looking for at the clinic. So ka PrEP, kile ka PrEP from the other clinic. So I decided to go another clinic. Then re ke fitha ko clinicing ke ba fa referral ya PrEP.
I eventually went to access PEP from another facility, and when I got there, I explained my situation that I had experienced in the previous facility.
So by ile ba ntima ka PrEP ba re ba ka se mphe PrEP because I'm a sex worker.
I was denied PrEP because of the reason that I am a person who is a sex worker.
I wish our government did something for the sex worker or ba kry services o tshwana le batho ka moka. Thank you.
I wish that the government could do something to ensure that sex workers get services just like anybody else. Thank you.
The next issues we are looking at are the STI services. Sexually transmitted infection screening and treatment services must also be available at all public health facilities. Untreated STIs are a significant enhanced risk for HIV transmission and contraction. However, not everyone attempting to access these services reported being able to. It was only 66% of gay, bisexual, and other men who are having sex with men, 59% of sex workers, 59% of trans people said that they could access STI screening services. This has reduced significantly since 2002, where we had 80% of gay, bisexual, and other men who are having sex with men, 80% of trans people, and 72% of sex workers who said that they could access screening services. So it has reduced from the last year. For those who did seek STI screening services, just under half of the respondents said that the staff were not always respectful. The most common reason for people not getting STI screenings was the staff asking too many questions about why they needed them, as noted by 35% of gay, bisexual, and other men who are having sex with men, 32% of trans people, and 31% of sex workers. Other reasons include people feeling uncomfortable asking for screening, staff being very rude, so people decided they didn't want to be screened anymore, and being told that you can't ask for it too often. Concerningly, 11% of respondents were told screening was not available for gay, bisexual, and other men who have sex with men. 11% were told it was not available for trans people. 9% were told it was not available for sex workers. On a more positive note, compared to 2022, there was an increase in the proportion of people who reported being able to access these STI treatments. The most common reason for being unable to access treatment was that it was out of stock. As reported by 70% of sex workers, 67% of gay, bisexual, and other men who have sex with men, and 52% of trans people. Other reasons, again, included people being questioned too much, so decided they didn't want it anymore, staff being rude and being told that you ask for it too often. Again, worryingly, 10% of respondents were told that the treatment was not for sex workers. 9% were told that it was not for trans people. And 7% were told that it was not for gay, bisexual, and other men who have sex with men. While there has been an improvement, absolutely everyone who needs STI treatment should be able to get it. Being a member of a key population can never be a reason to deny someone these services. Now we are moving on to the recorded stories.
I go there to get condoms, HIV testing. There are more things I would like to do there, but I'm afraid, like testing STIs. I cannot speak to them because they will discuss me and probably not help me. I just keep myself and do not want to be ridiculed by them. They will embarrass and shame you.
I personally used the clinic for my HIV treatment, and because I'm a sex worker, I mentioned before, I used to get STIs from my clients for a lot of different reasons. And you see, in my line of work, you can't not say, I don't want to use a condom if somebody's offering you more than what is supposed to pay you. So there's no, I can't try somebody else. No, you're going to do it. And obviously you're going to get STIs and things like that, but that's the price we pay. And everybody knows that, you know. So going to a health facility, you're expecting the nurse to understand, not to tell you that, like with myself, I was told that I'm keep on coming back for STIs, and I was told that I should bring my boyfriend. Which boyfriend are you talking about if you're telling me I should bring my boyfriend? I don't have a boyfriend. The boyfriend is a luxury in my line of work. But that's the way she said it. And I wasn't told to get out, but I mean, those words already tell you to get up and get out. I'm not going to help you. So because of that, I had to change health facilities.
After experiencing hostility and discrimination about living with HIV, when trying to access ARVs, I also had STI symptoms but decided not to continue with the consultation because the nurse wasn't welcoming. As she gave me back my card, she said, "Maybe now you have attended initiation school, you will stop being gay and be a man." I had to go to another clinic to get help.
Umsebenzi wami engiwenza ngisebenza emgwaqeni ngisebenza emgwaqeni. Okubuhlungu ngathi thina sisenza emgwaqeni kuyo yonke indawo la esihamba khona abasithatheli. So XCI yakhona bekade seyinuka to a point ukuthi bengisabuke esibhedlela. Ngathi mangifika khona esibhedlela bathi honest bengihlaleleni isikhathi eside kangaka ngazi nifanele ngisebenzise condom in and I was like hayi ngoba nakho i-condom bengasebenzisi bengisebenzisa but emva lokho kunokuthi bangisize bakhetha ukuthi bangidelele bangimemeza ngayo bangibiza ngayo wonke amagama lento yenzeka ngoMay 28 eArkhekhan yeah lapho nakhona ngagcina ngiphumile ngathola ngosizo ngaze ngasizakala kathi BK lezo azitholakali kalula especially mawuqhunyelwe condom there's the thing ukuthi mawufuna amaphilisi kubona bakutshela ukuthi hambe wathenge chemist kungajabulisa khona mangase ngelinilanga bakwazi nabo ebhedlela bakuthi babe nawo basikwazi usinikeza if siwacela bengasinyasi if ukuthi mhlambe sinezifo esinazo zangaphansi zasemzimbeni like ngoba yonke into ephathelene nomuntu ophantayo emgwaqeni ayikazi yathathelwa entweni ayibhekelwe entweni yeah.
I had 2 STIs in a space of 3 months, and every time I went there, they kept on saying, that is the only reward you will get as uMahosha. I could not feel respected enough, but I could not raise my concerns because I desperately needed their help.
Good day, everyone.
Eastern Cape.
I am from the Eastern Cape.
A gay clinic, a day clinic.
I went to a day clinic.
STI.
I needed assistance in terms of an STI.
I get a consultation room.
When I got into the consultation room, there was one nurse present. She asked what I was there for. I advised her, and then she asked where my partner was. I advised her that I don't know, I've got more than one partner. Then she laughed at me. And then called another nurse into the consultation room. Right. She then advised that I was going to be tested for HIV in front of the other nurse, which was now called into the consultation room. I advised that I was not ready for that test to be conducted. They both laughed at me. They then carried on judging me. I then decided to leave. I then went to KwaZakhele Clinic, which is where I received help. Thank you.
Sanibonani.
Good day, everyone.
Mina ngayi clinic yasemzinti.
I went to the Mzinti clinic.
Mangifika lapho ngimuntu lo shushumbisa ngemtimba.
I went there as a sex worker.
Ngacela lisito ngoba benginetifo temagcasi, ma STIs.
Right. I went there because I needed assistance in terms of an STI.
Kwakumnanzi nje masikhuluma nalo sesi.
Right. We had quite a casual conversation, me and the nurse.
Kwabese kuchintsha nje mase ngimtshela ukuthi ngishushumbisa ngemtimba.
However, the conversation soon changed when I told her that I was a sex worker.
Wabese nje ubita abantu la sebenta nabo laphana sibangibita ngemaslay Queen Fairy.
She then called her colleagues, of which they started calling very derogatory names, started using derogatory names towards me.
Ngabona ukuthi angiphathenga kahle.
I realized that I wasn't receiving the best care.
Sengiloku ngaphuma ngahamba ngothola lisito kadokotela.
I then decided to leave the facility and rather get assistance from a private doctor.
Ngiyabonga.
Thank you.
Molweni.
Good day, everyone.
En sukwa eGqeberha isi.
I'm from Gqeberha in the Eastern Cape.
Ndaya ekliniki ke ngenye imini 3:30 xesha nje kalanga.
I went to the facility this one day around 3:30 in the afternoon.
Ndiyafika ke ngoku security molo bhuti unjani? Hayi bhuti ndi right sisi nam. Ndamcela man bhuti mandize ekliniki andiphilanga.
I then exchanged pleasantries with the security guard and then advised that I am there to consult with a nurse as I am not well.
And then wathi ubhuti zingenele ngokwakho sisuyova phaya reception yonke incukhacha zalapha.
Then the security guard proceeded to tell me that I should go in and hear for myself what the system is here at this clinic.
Ndadibana nentwazana receptionist phayana ndayixelela bandize ngantoni. Wathi ukuba ngaba sisikuqetywe usetyenzwa namhlanje and lixesha lophuma ngoku because almost kuzobe 4:30 or 4.
Right, when I got to the receptionist then told me that they are no longer working as it's almost 4 o'clock and it's their knock-off time.
Ndayicela le ntombazana khandibizele umanager apha.
I then asked for the facility manager.
Wathi ayikho.
She then advised that there was no facility manager present.
Ndathi ngicela udeputy please.
I then asked for the deputy facility manager.
Wathi naye akakho.
I was also advised that the deputy was also not there.
Ndathi ngicela unompilo okhoyo osebenzayo.
I then asked for a nurse that might be on duty at the time.
And then ndamfumana.
I got a hold of a nurse.
Ndathetha nomama ndathi mama man andiphilanga apha and ke ngoku ixesha endixelwa ngayo ye-receptionist ithi bangaba ku-almost 4 ngoku so anisebenzi nina ndibe mna ndiyayazi into yoba ngabe ikliniki ivala 4.
I advised that I was not feeling well and all I am receiving is just talks that the clinic is almost closed. However, I am not well at all.
And then wathi umongikazi kumbana hayi sisi bendicela ufike apha 7:30 otherwise ikliniki ivula u-8.
I was then advised that I should arrive at the facility around 7:30 in the morning as the clinic opens at 8 a.m.
Hayi ndazama uthetha nomongikazi indaba yokuba ngaba andikho right and then andikwazi usenjikise ndilapha ezitholampilo kodwa andiphilanga. Wathi unesi ana sisi hamba ugoduke uzofika 7:30 uzoyakala kusasa.
I tried to plead with the nurse advising that I honestly am not feeling well. This is why I came to the healthcare facility. However, I was still advised that I should come back the following day around 7:30 to be assisted as I could not be assisted that day.
Hayi ke ndabamba igama lenesi. Ndaqonda uba ngengomso ndiyafika.
I then took the nurse's name and told myself I will see the nurse the following day.
Hayi ke ndagoduka andancedakala ngalamhla.
I then went back home without any assistance on that day.
Ndafika kusasa nyani 7 o'clock. Iqueue inde ke kumiwe hayi ke noba ndabangobe 13.
The following day I arrived in the morning around 7 a.m. and the queue was already long.
Yani ke ndadibana nalo nesi ndandibambe igama lakhe. Hence wayethe bangaba mandifike ngo7:30.
Surely enough, the nurse that I had spoken to the previous day was on duty that day who said I should arrive at 7:30 in the morning.
And then ndaya kuye straight ndafika ndamxelela sisi ndilapha mna ngoku yesterday ubuthe kum mandize ngexesha ndifikile ngoku ndifuna uncede.
I then went straight to her and advised, I was here yesterday and you advised that I should come today, the present day, and I'm expecting you to please assist me.
Athi bangaba unesi okay sisi khame kancinci manje safuna ukuqonda phanga phakathi ba kwenzeka ntoni. Ndathi sisi ngicela ungalinisi ixesha elinintsi because ipain enikuyo ngoku this morning ingapha yakho umlingo.
The nurse told me to hold on a bit as she still wants to check in the facility what is going on. I then advised the pain that I'm in right now is a whole lot worse and I need assistance now.
Hayi nyani lapha to 8 nesi wandibiza. Wathi sisi iza ngapha. Ndathi nake okay ndayi. Xa ndifika kuye egumbini ndafika ndam-explainela bangaba ndinale STI apha and ke kuibhlungu. Athi bangaba yena bangaba okay abuze bangaba kumbana ngaba ingaba tani into nebangela uba mawube ne-STIs ndimxelele into yoba ngaba I am a sex worker, and then at the very same time kwindawo esihamba kuzo, like when we are using the toilets and stuff, maybe I got there maybe information or STI, I am not so sure. Athi bangaba hayi sisi man suphosisa apha.
Right. Surely enough, just after 8, I was then called to the consultation room, and then I explained what the problem was with myself. I then advised that I believe that I have an STI. I am a sex worker, however, I'm not quite sure where I got the STI. It could have been from an unhygienic bathroom, or maybe from a sexual partner.
Hayi ke athi bangaba komusisi bangaba okay uzonilungiselela. Ndabe nisithi on top of that, since hence andilapha eklinikini cela undenze i-HIV test so that ndibe nokwazi uba aware bangaba what's happening. Athi bangaba isisini izinto ifunayo wena ngoku.
The nurse then advised that she would be able to treat me. I also asked for an HIV test in addition to that. The nurse then responded back to me saying that I'm now asking for too many things.
Ndaqomba yana understanding. That make on top of that, for your response, could you also do a pap smear on me so that I can know, Alice, because it seems that you are not going to do your work here while I am here, because ndinida zonke services so that ndizokwazi yonke into yenzekayo, because thina singamantombazana sinezibeleko, and then funeke eteste in each and everything that eyenzekayo kum ngaphakathi. On hence that ndi sex work makandincede today because ndi on time now.
In addition to that, I asked for a pap smear. I also advised that with me being a sex worker and me being a cisgender female, there are services which are specific to me, and I need for them to please be conducted that very same day, since I am there on time.
And then ke kwathi usisi hayi khame kancinci ke sisenza kunceda ngokukhona omnye ofuneke ni-assistile apha kulo msebenzi lo ufunayo because umninzi, and ke ngoku wena bengicimba mfana bizolo ngoba ufikile apha uzokwenza into encinci apha. That make if ever bundincedile yesterday bengazobakho issues. On top ke ngoku ndikuzitholampilo, I have to know yonke into eyenzekayo empilweni yam, and then wena uzonceda since ba ungumongikazi. There is no rush now, there is a time, and then ku-early noba early for bangaba mawundincede.
The nurse then told me that she would need to call another nurse to assist, seeing that I'm asking for many things. I then advised that perhaps if I was assisted the previous day, then we could have only just tended to that. But since I'm here on time at a health facility, I need all of the things, all of the tests that are relevant to me be conducted.
Thank you.
Thank you.
Molweni.
Good day, everyone.
Ndisuka Eastern Cape, ndandiye ekliniki Eastern Fortress Clinic. Ndiyofuna uncedo because ndandorhaliselelwe apha ngaphantsi.
I am from the Eastern Cape, and I had visited a healthcare facility in terms of treatment.
Ndaya ke ekliniki ndathunyelwa kunesi ongubhuti. Ndaya ke ndafika ndamchazela ba ndinorhazela apha ngaphantsi. I'm a gay man who's enjoys sex with other men. He looks disgusting and no shame. Wandibuza kanti le nto ndizeleyo apha.
I then consulted with a male nurse, of which I advised that I was a gay man. He looked at me with great disgust and asking, is that what I was there for?
I felt offended ke ndaya nomreporter kumanager. No, where's the manager? Now manager, he tried unbribe aba hayi awonke don. Ndabona ndifumana uncedo, ndamandikhangele omnye unesi. But naye ndalifumana uncedo xa ndiye unesi ongumuntu ongusisi.
I then escalated the matter to the facility manager, who then tried to calm the situation. However, I was still not assisted at the time. I then requested for another nurse, please assist me. I was then assisted by another female nurse where I was able to receive help.
Thank you.
Thank you.
Next, we will look at arm reduction services. Arm reduction services like new needles, naloxone, information on safe drug use, methadone, psychosocial support are life-saving. However, they are almost entirely unavailable in primary health facilities in the public sector. Even getting information about some of the services can be a challenge. On top of this, while people should be met without judgment, people who use drugs are often met with open hostility. Only 9% of people who use drugs told us that they could get information on where they could get new needles. This despite the benefits of not reusing or sharing needles on reducing wounds, the risk of endocarditis, or transmitting HIV or hepatitis. Instead, people can be told that these commodities are not for them. Ensuring access to new needles and syringes and providing a safe place to dispose of used one is a key component to harm reduction. Not only supporting people to take drugs safely and reducing the burden on the healthcare system overall, it can also support a reduction in syringe litter in public spaces. Naloxone, a life-saving opioid overdose reversal treatment, remains a nurse-initiated only treatment. 10% of people who use drugs interviewed needed access to naloxone in the last year. To be effective, naloxone needs to be carried by people in the community and available to peers and partners to initiate if needed in a timely manner. Instead, some people die before ever getting to the facilities. Others die while waiting for ambulances, and others can be treated cruelly and made to wait when in need of urgent care. Methadone, an important treatment to help people safely reduce or stop taking opioids, is unavailable at the facility level. Only 10% of people who use drug interviewed were even given any information about where they could get it. It is unrealistic to think that people will be able to afford to see a private doctor and pay for a prescription, or that people will be able to afford to attend one of the few drop-in centers or harm reduction centers across the country on a daily basis. Methadone must be made available closer to where people actually live in order to be useful. Drug dependent support and other psychosocial support also needs to be made available. 24% of people who use drugs that we interviewed wanted drug dependent support in the last year. 1,224 people, which equals 1,224 people, yet only 16% of those were actually able to access them. The most common reasons people gave for not being able to access it were it was not offered at that facility, or they were too uncomfortable to ask for it, or they were told that they were not eligible. We now move to recorded stories.
They know that I use drugs at the clinic after I went there to ask for methadone and new needles. They asked me who taught me drugs, that I cannot come to the clinic and ask for needles so that I can inject drugs. Needles are for injecting a sick person, not someone who smokes drugs. I felt my heart ache. I then asked for methadone. They asked why don't I take the money I used to buy drugs and buy methadone instead. I felt judged, hurt, and humiliated.
Shooting edit, just mama apply the rehab, shooting clinic being out what is medical. Obvious, I'm expecting with bang was in the phone and then what you told him paying into now security work. Ono would know again about boozes of funa and no booze with can dark funua. Then to but he scheduled 6 but I made about the back need and she was sitting car methadone as a rehab sister.
Yes, I used substance, crystal meth. Then we go to our clinics. We don't have kind of things that we call counseling. As much as we had a youth center. Go to the youth center now. It's vanished. most of them who uses a substance, they taking needles. You get my point, Molong. It's obvious it's blood to blood. I don't know your status. You don't know my status. Most section e ke le mo yone clinic ya rona ke Tsholofelo clinic. E ke tseba nna ko reng. Some of those people who work in there, they giving these people kinda syringes because where am I going to get a syringe whereas I'm not working at the hospital or at the clinic? Some of them are busy selling ARVs. You get my point? Just look around.
Bitso la clinic ke Tshepo mona Langridge. Nna ke motho ana sebedisa di-drugs haholo. Mo ke ne ya teng Tshepisong clinic-ing ke ne sa thole treatment e ke batlang cause nna ke ne sebedisa boma di-drugs, yeah, something like crack le into tse jwalo di tla nlahlehisa le hape ke fitla clinic-ing ba ga ba no kgona ho thusa motho a tshwanang le nna tjenana plus ke a ba utswetse nkare ke a ba utswa ba re ke a utswa ntho tse jwalo tse ngata tse fapaneng so qetetse se ke tlohella fela ka hore ke la tshwara ke TB so ka ba kgona ho nthusa ka TB fela ke ne feel pain ke ne bona nkare ha ba kgone ho nthusa ba thusa batho ba kgetholla ntho tse jwalo ya lape ba bang bana jaja hore tsena ke qadile ke le one tshwantse ke qete ke le one ntho tse tshwanang le tsena so ka ke end up vele se ke ba le patient hore ke dule ke ya bantsa re manta ke jwalo until ke be ke thole thuso so end up there help me.
Ndingumuntu ochaya i-drugs. Into eyenzekayo ndathi ndichaye kanti ndiya-overdose. Ngoku ke into eyenzeka ndaya ekliniki. Xana ndifika ekliniki kwathiwa ekliniki eGombo ekliniki kwathiwa ndizenzile. So akho nto banoyenza bona. Ever since then ke ngozange ndiphinde ndilufumane uncedo uba nangosaqhubekeka kutshaya i-drugs. Zange ndilufumane uncedo endandifuna uyolufuna njengamntu owaye wathi tshaya ndi-overdose ndamongoza ndathini kwafuneka ndidibanise nekliniki sabakwazi undinceda ngoba kaloku babona uba ndi-overdose nam ndayithetha inyani kodwa zange bakwazi undinika uncedo into ndayifumana kushawutwa. Akho nto ndiyifumanayo xa nokuba ndiyile ekliniki andifumani zi-injection andifumani zinukula akho nto ndizifumana akho nto ndiyifumanayo xa ndiye ekliniki njengamntu utshaya i-drugs.
Lebitso la ka ke Zakhele Julius Lomo ke dula Nyakalong a Langridge ke ne ke na le bothata ba di-drugs ke sebedisa di-drugs so ka end up ke batla ho fumana thuso se ke le tired ko sebedisa di-drugs ka qala ka ya clinic-ing enana e haufinyana ho thweng ke thusanong clinic ha ke fihla mono ka fumana hore ba mpella ntho hore bona ba ke se kgone ho nthusa mabapi le bothata bo ke nang le bona ba ho sebedisa di-drugs ba mpella ntho hore je ka ile hore nna ke itlalletse tsona ho di tsuba ke tla di tlohella ka bonna ha hona thuso e batlang fang yona ke ntho ke nyaope batho ba bangata ba e hlalosa e le nyaope nna ko hore fela ke tsamaye ke ipe hantle nna ke rehabilitate ka bonna ha hona next le medicine a tlang fang yona ka fa injection yana tlang fang yona and ka nako eo ke a kula ho bohloko ke di-pain e ka ka mfala e ka ba go di-pain bo konyana mara ha tlo am feeling next so ka ke nahana ke utlwa le batho ba bua di-advice di tswa bo batho doctor before ke ikwalla ka drugs e ke tloletseng ka yona ke ile doctor e bitswang Dr. Mtsweneng monana ka nka prescription ka ya o dindala chemisting ka nka methadone ha ba nthusa ko nwele about a week after a week ka o fedile ka continue hape ka tsuba.
We now move to community members that are joined us in the house.
Dumela.
Good day, everyone.
Ke tswa Foslora se clinic ene ke tsamaya ke extension 2080.
I am from First Loras and the facility that I use is extension 28.
Most to ha ke ya ne ke ya ke le one because of ne ke tshaba gore nka le bakgotsi ba ka ne ba kgalemela now and then tabeng ya di-drugs gore re tlohelle ho tla because of most of ha ba batle gore fa dinalete.
I usually went to go consult on my own. I was a bit hesitant to go there with my friends, as the clinic did not want to share needles with us, new unused needles with us.
Ba re discriminate, ha ba re hlomphe, ba re bua hampe, ba re bua le ntho tse mpe gore na re tsamaya le bo mang, ha re hlomphe ka nako ha ba tsebe hore bophelo ba rona re phela jwang, situation e etsahalang ko hae, batswadi le tjhelete re nka kae ya hore re reke bo ntho tseo cause ra sokola.
We are disrespected and disregarded without even knowing what our story is about.
Nna ke batla fela hore ba thuse hore clinic eo e change ya extension 28 because of ha ba batho thusa batho ba bua le batho hampe, ha ba hlomphe behavior ba bona towards rona ke bo bobe, and be etsa community e phele complainer ka bona because of manese a mang ha bana taba le batho and ba dula ba tsamaya.
I would like to plead that a lot of sensitization be done with that specific clinic, as many people, even the general population, complain about the treatment that they receive there.
And how ya hape ba o botsa gore stock wa se o sa bo dinalete o ha batla go itlhaba ba o botsa go itlhabela eng o batla go shwa wena skatane ba bua nthonyana tse mpe dipuo tse mpe so le wena o feel ka reng ka se gotlele anymore.
Usually when we go there and ask for key population-specific services, we are ridiculed, and instead of receiving the care that we need or referrals, rather we are met with unkind words.
Sanibona ma comrade. Sibingelele na wonke inhlangano ekhona.
Good day everyone, good day comrades.
Bingelele ku Ritshidze. Mina drug user, I'm from KZN, ngihamba i-Bellevin Harm Reduction Center. So ngiqala ukusebenzisa i-Bellevin 2 years. Ngizocela ukuthi ngiqale ngibonge kwi-Bellevin.
I am from KZN. I am a person who uses drugs. I've been using the Bellhaven Harm Reduction Center for the past 2 years now, and I would like to first thank them for the services that they provide for us.
Yeah. In the last 2 years, eminyakeni emibili edlule bengikade ngivuka ngiyecala ukuthi ngizovuka manje kuseni ngibambe inkunzi, emini ngimele ngibambe inkunzi ngiphinde ngibheme, nantambama ngiphinde ngibambe inkunzi ngiphinde ngibheme for 2 years.
My old routine before being introduced to Bellhaven Harm Reduction Center was that I'd wake up in the morning, have to resort to crime so that I can ensure that I'm able to receive or buy the drugs that I need, and again in the afternoon and later on that day. That used to be my routine for about 2 years.
So after these 2 years, there's been a lot of change in my life. So I've been thanking Bellevin, but the problem is this is not only for me. There are still others who are out there who want to get inside Bellevin. So they don't have a space because we already, lots of us who are there. So this thing is helping us. Not only me, there are even brothers back there. They are in a meeting while you're in a meeting right now. So I'm here for them, for myself. Please, we need help. The staff is less. In Bellevin, maybe we got like 209 patients. On the 209 patients, we got 1 social worker. On my own knowledge, I know that the social worker should know every patient, the problem that he has, why you are here. For one person, the social worker, it ended up naye ebanenhliziyo encane ngoba phela sibaningi ngeke umiswe abantu about 10 ekuseni kuze.
Because the Harm Reduction Center is so understaffed with us only having 1 social worker, they would also lose their patients with us because there's too many of us for them to handle.
Yeah. So engingacela ukuthi sicela isupport ukuze kwazi ukuthi nalabo abanye abangaphandle basizakale njengami nabo bakwazi ukuthi bayibambe bangawenza amacala.
I would like to plead that the Harm Reduction Center receives more support so that people like me and brothers and sisters that are out there can also receive help without having to resort to crime. Thank you.
Next, we look at gender affirming care. To provide gender affirming care means that the public health facilities should respect trans and gender diverse people and ensure they feel comfortable in their gender identity and gender expressions. This includes using the correct pronouns and names, removing colored folders and making gender, allowing trans people to use the right toilets and providing a gender neutral toilet. Having posters that affirm gender diversity people, being respectful if someone's gender does not match their ID marker, and so on. In this reporting period, only 32% of transgender people interviewed said that the staff were always respectful. These results are worse than our findings in 2022, when 40% of trans people said the staff were always respectful. 64% of trans people said they used their wrong names, and 64% said they used their wrong pronouns. Moreover, 26% of people said the staff were rude because they were trans. 12% said the staff asked them questions about being trans, not related to the service they needed. And 10% said they told other staff members the person was trans for no reason. Other people also complained about not being allowed services because they are the wrong gender or getting the wrong colored folder. All of this adds to the discomfort, lack of safety, and gender dysphoria trans and gender diverse people may feel while at the facility. Another challenge is for the trans women to be told to use service delivery points for men. Like Men's Corner, these types of interventions have been established to encourage cisgender men to go to the facility with a positive impact. However, no trans woman should ever be made to use this one. Trans women are women, yet 21% of transgender women interviewed reported being told to use one. Being forced to access services in spaces designed for men can be, at best, immensely uncomfortable and, at worst, extremely unsafe. It outs transgender women as trans and puts them in the line of fire, face transphobic verbal or physical abuse or attacks. 39% of transgender women interviewed who were instructed to use men services points did go through the indignity of using these spaces, despite the risk. However, 33% reviews ultimately not receiving the services they needed, leading to different types of risk. 24% said the staff were rude when they tried to explain why they didn't want to use the space designed for men. And only 15% were able to get services elsewhere in the facility. Forcing trans women to use spaces for men is not a gender-affirming care. It is reckless and dangerous. Clinicians at public facilities must be trained to better understand the health needs for trans and gender diverse people and be able to offer appropriate service in caring, respecting, and compensation manner. In addition to the standards of primary health package, trans and other gender diverse people may also want information and access to hormonal therapy. Gender dysphoria can be extremely distressing and can lead to broader mental health issues. This is also in a context of living in a country rife with transphobia and attacks on trans people. Hormones are a life-saving treatment, yet hormone therapy is not available in the primary healthcare system, despite need and demand. 56% of trans people interviewed this year wanted to access hormones at their facility. Yet 24% of those who ask about them were confronted with this were confronted with a staff member that did not know anything about the hormones or where to get them. 31% were told to pay another doctor for a referral. Where people do find enough information about hormones or get a referral letter, often this means traveling long distance to few hospital in places like Johannesburg, Cape Town, East London, or finding a drop-in center in few areas across the country. For those without the money to travel to these places or at the end of a long waiting list, it means hormones remain out of reach. However, with a change in a national policy, hormone could be prescribed by doctors at a primary level, just like they are by private GPS, expanding access to many more trans and gender diverse people in need. Centers of excellence must have access to medical support networks, mentorship, and telesupport to assist the consultation on the use of hormonal therapy for trans people. Now we will move to recorded stories.
Okay, my name is Ritshidze Ramtsamai. I am born and bred in Kutsong, Carltonville, West Rand. So I am a transgender woman. I started transitioning by the age of 18, 2019. Being at the region where, like Johannesburg, hormone replacement therapy is not a problem. So since I moved from Johannesburg to the Northwest, due to studies, I struggle to access hormone replacement therapy because I have to travel now and then to Johannesburg from Mafeking. So it's costly, and sometimes I stay without HRT, and that affects my well-being. But they can organize people from the LGBTI, and then the clinics provide the primary services for transgender people, like psychology and therapy, and then access to hormone replacement therapy, because a lot of transgender women here in Northwest Province, they are not on HRT, and they self-medicate and end up having their health at risk. So I would like the Northwest Province to provide at least those primary services for transgender women.
I try not to use the toilets at the clinics because of the experience I had. They told me that I'm not a woman, I'm a man, so I must use the male toilet.
I would like the health department to help us with planned patient transport. That's the solution for now. Because we tried asking for hormonal replacement therapy, treatments, or the pills or the injections that we need from the facilities, and they refuse to give us. If they have claimed that they cannot help us, can't they at least, if there is a planned patient transport that can be issued out for us, and referral letters to the big hospitals that are actually rendering such services, then we are able to can go without having to worry about transport. That is now the solution that we can have, because failure to doing so, there are so many other issues arising from not only just going to the healthcare facilities and accessing the services, even general services, we can't even go due to the maltreatment that we receive from the healthcare staff and doctors who are not understanding, who choose religion over their jobs, simply because now they can't help us because it goes against the religion. Now, if they were able to can now provide us with a transport that will take us to the facilities that are going to help us, then it would be better.
Most of the time, the people in the clinic, they will call me by my name or call me brother or he. Even when I correct them, they still continue to do the same thing and call the next person to look at this one that want to be addressed with a female pronoun when he is a man. I gave up because clearly those people don't want to learn. They do not want to change.
Oh, ndihlala elibode elangeni. Iklinikhi yami endiyisebenzisayo yimalusi. Isevisi endakhe ndayifumana phaa ndakhe ndayikliniki. Kwathiwa xa ndiyotesta phaa ndizayifumana njani i-HIV ndilala namanye amantombazana, which is loo nto yandiphatha kakubi ne. I-toilets, I'm not comfortable using i-toilets zamantombazana because I'm a trans man, and I'm not comfortable nakwezi zamadoda. At least if bekukhona eza toilets ze-LGBT yabo benzoba comfortable. Eyona nto yandiphatha kabuhlungu leyo. Ugezelo noba ungononga indoda, yazi loo magama, ungononga indoda bayakumispronounce. Yeah, laa nto uba at least babe nee-toilets ezezethu. I'd never go back to Malusi Clinic because they do not have privacy, confidentiality. That's why I'd never go there. Laa nto uba kuthiwa ungononga indoda ayikho mandi kum. Uyamazi unonga indoda yinto? I don't know once understand sanjani, but in Xhosa umuntu who looks like a man, so they mispronounce abantu. So I do not like Malusi Clinic.
I identify as a trans woman. I live here around Qwaqwa at Bulkambush. I attend the Bulkambush Clinic. I take my antidepressants there, and my sleeping pills there. Really, the services that I want from the clinic is the HRT hormones. Yeah, because I'm a trans woman. I want to change. I want to feel like a female. I want to feel like a woman. I want to look like one because I'm a trans woman. And what I can say about what I don't like about the clinic is that I think maybe they like information about like us as trans people, because I remember the first time when I wanted to actually take HRT hormones, I went to Manapo Hospital. I was actually referred by a nurse from the Bulkambush Clinic, and she told me like to go to Manapo for an appointment. She booked me an appointment, and then I went to see the psychologist and the doctor there. They actually told me that I can't actually, it's a long list. There's a lot of candidates actually who want the full procedure. So what I really don't like is that there's no actually services for us as transgender people at the local clinics.
I went to the clinic to inquire about hormones. The nurse told me that because I'm a man, I cannot need hormones. It is like they have not been sensitized. They have no idea of who trans people are or what type of services we need.
We now move to our community members who have joined us in person.
Yes, comrades. Before we proceed, we have comrade Saira from PEPFAR. She was supposed to have left at 1 o'clock, but I asked her to spend some few minutes to listen to the colleagues. She is the acting country director of PEPFAR. I think before she leaves, we need to give to her, and then we proceed with the program. I am not trying to make her special, comrades, but she has to rush somewhere, so that's why I am giving her an opportunity to comment and respond. Over to you, comrade.
Thank you so much. Yes, my name is Sarah Johnson Qureshi. I'm serving as the PEPFAR country coordinator here in South Africa. First, just to follow protocol, I'd like to thank and acknowledge anyone who is here in the room, also online, National Department provincial departments, Deputy Minister of Health, civil society members, TAC, Ritshidze, of course, everybody here in the room, SANIC, UNAIDS, and any other multi-organizations who might be present, all protocols observed. Before we start, I just really want us to just take a moment to pause and just acknowledge the profound injustices and trauma faced by marginalized and key populations, not just here in South Africa, but also globally. You know, when we first started, and Ellie talked about Uganda, Kenya. I was actually, prior to South Africa, I spent 2.5 years in Kenya. I just read the headlines today that there's another anti-LGBT bill that's been passed in Ghana. And so there's definitely, it's just definitely, injustices and trauma that are happening worldwide, and especially on this continent. I just also want to take a moment to just recognize the marginalization, stigma, and the significant barriers that you all have in accessing essential healthcare services. PEPFAR, we stand on the pillars of respect, trust, humility, and equity. These are our core principles for our program, and they are core principles shared and demonstrated and led by Ambassador Nkengasong. We strive for equitable treatment and outcomes both for the populations we serve and how we operate internally as PEPFAR staff, and how we also expect our partners to operate. And I can see by the reports that you all have shared today, by the actual paper report here, the stories that we heard, that we haven't met the mark, right? There's definitely some work to be done. And I just also want to acknowledge all of your stories. It takes the trauma involved simply by existing, simply by just going through your daily life to survive. It takes strength, it takes bravery and courage and vulnerability. And I just want to take a moment to acknowledge that and let you know that I hear that and I recognize that. Our commitment to supporting key population, it isn't just a duty, it's a moral imperative. By delivering essential healthcare services and in fostering inclusivity, we empower individuals to lead healthy and fulfilling lives, free from stigma, free from discrimination. As Ijeoma Alua eloquently put it, when we identify where our privilege intersects with somebody else's oppression, we find opportunities to make real change. In standing up here as PEPFAR, as such a large program with resources, we have to acknowledge that we have that privilege, and with that privilege comes a responsibility and a duty to be an agent of change. So my friends, I'm speaking to our PEPFAR staff and other donors. Let's utilize that privilege and stand as agents of change. Together we can shape a future where all individuals, especially key populations, have equal access to quality healthcare and opportunities for a brighter tomorrow. Again, I want to thank you so much for your time. My apologies for having to exit early. Let's continue to stand united in our efforts, knowing that our work is essential and transformative, hopefully transformative. That's the goal in the lives of who need it most. You all. Thank you.
Hi, my name is Evie. I'm from Northwest. I use the clinic called Wonderkop. Okay, cool. I went to the clinic and I got there. Luckily, I have a friend that she works there. Then we went to this room where you do your BPs and everything like that. So everybody's in the room. It's like 2 sisters and 2 clients, right? Then, okay, cool. The sister asked me, what is it I'm here for? Then I tell her that, okay, cool. I just want hormone replacement pills. Then she was like, okay, cool. So you just want to take off the penis and whatsoever. Sorry to use the word, but like, yeah. Then it didn't sit well with me, because you can't say I want to take out the penis, you know. as I come to the clinic, I prefer to be respected. What I have between my legs, it has nothing to do with anybody, you know. So okay, cool. I never felt comfortable, but like they did help me for a few months. Then everything stopped because they said like the pills are too expensive, so they can't sponsor me anymore. So I had to move to the other clinic. Then I couldn't get help. So yeah.
Greetings. Well, I'm a transgender coming from a small town called Ritshidze. So I've just got one problem with this Hope Clinic that I'm using as my facility. Hormonal therapy is a problem, people, in Ritshidze, because we have to travel all the way to university so that we can get the HRT thing. So can at least get this thing in our clinic. Thank you.
Dumelang.
Good day, everyone.
Nna ke sebedisa clinic ya Albert Luthuli. So problem e ke na le yona ka Albert Luthuli clinic ke unfriendly staff. So it be ra ha o kena go consultation room. Sister in charge o tla be a o bitsa ka mabitso a seng right a etsang o feel uncomfortable.
I use the Albert Luthuli clinic. My main area of concern with the clinic is that the nurses tend to be very unprofessional. They use words and names that are unfriendly towards us when we go consult.
Mabitso e kang Osbuti, Osmantate, mabitso a seng hantle.
They use a lot of unkind and derogatory words such as Ausbuti or Mentate, or words that really negate who we are.
So ho sebedisa public health facility hona ke bona ho le unsafe because ke bona re sa bolokeha.
I feel very unsafe using a public health facility. I feel that more can be done.
Thank you.
Thank you.
Sanibonani.
Good day, everyone.
Mina ngisebenzisa iSibhangi Clinic
I
from
u-
Komas.
I use Bangi Clinic from Komas.
Ngeti 19 of January. Ngiya lapha every month mina ngiyaya ngiyofetha iPrep ngitsheke ne-HIV.
On the 19th of January, I went and consulted. Every month, I collect my PrEP there and as well do the relevant tests that are
Yeah.
needed.
Yenda lokho ke ngoba ngithandana nemuntu HIV positive. Ani
I do this on a regular basis because my partner is currently living with HIV.
so ngithi 19th of January mangifika edini ngifika uthi le security guard. Oh. So wena ufuna la and why ugcwele roko? Bengicela roko. Uthi why ugcwele roko? Umfana.
Well, on the 19th of January, I had went to consult and I was wearing a dress. The security guard then proceeded to ask me, why are you wearing a dress when you are a boy?
Wabita lo behleli naye wathena buto bona nang but sis.
He then called his colleagues to come and see me whilst using very derogatory words towards me.
Wangibuza wathi ngifunani ngifuna ukuthi bangijubele igwayi yini.
He then asked me, what do I want? Do I want my genitals to be cut off?
Oh mina ngathula ngoba mina ngikudi ke ignoring bantu. Ngathula ngababungu.
I did not respond. I just looked at them.
So wonke umuntu lo basegedeni wagucuka wangibuka ngachubeka ngangena ngahamba ngohlala ngalinza ukuthi batonginaka.
I then went into the facility and joined the queue.
So ngahlala lapha ngahlala ngalinza ukuthi bangibide. So uma bangibida ngangena mangena lo nesi wahleka ngathi ukuthi beyahleka ini ngaze ngagucuka ngabuka emuva.
When it was my time to be in the consultation room, the nurse took one look at me and started laughing hysterically. I then turned right around and left.
So uma ngigucuka ngibemuva uthena semadvodza lagcoka tinto tebafati kusukela kuko naloko ke.
As I was walking away, the nurse then proceeded to say that, so now men are wearing female clothes. What is that all about?
So ngathini mina ngathi ngisangena ngahlala phasi uma ngihlala phasi wathena oh kepha yini nine ma teenager ali South Africa nithandza ukutenda ngathi nihlala eAmerica.
She then continued to say that you teenagers of South Africa make it as if this is America.
Oh mina ngathula ngambuka wangibuta ukuthi ngifunani lapha ngamtshela ukuthi oh ngifuna ukutesta ngifuna nema prep wathena ake ngimangale ungaba positive ngoba nine bantu abasona thengisa nithengisa ngemtimbo.
I then remained silent at her sneers. They then asked me what I was there for. I advised that I would like to get tested. And then she said to me, I wouldn't be surprised if you were living with HIV because people like you usually sell their bodies.
So uma ngihlala ngimlinza wakhipha letinto wangitesta uma testa njalo uyahlekelela like uyahleka ukhuluma ne phone call angani ukuthi bayaxoxa nabani. So ma results aba negative. Wathena yo kuyacala kwendeka lokho ngoba nini sanadi nini.
She then conducted the test while she was on while she was on a private phone call. The test came out negative, and then she said, surprisingly, that, wow, this is the first time this has ever happened because we know you people.
So ngathi mina oh ngicela ama prep ngoba nginemuntu lemuntu engithandana naye u-HIV positive.
I then proceeded to ask for PEP as my partner is currently living with HIV.
Oh wathena uyahlanya angeke singinike lokho ke ma prep ebafati ma wena lokhu ulala nemuntu we-HIV ulala nemuntu we-HIV ufuna uthebe ukuthi thina sidoni ama prep hayi asinginiki wena ama prep.
The nurse told me that I was crazy. PrEP was prescribed for females, and you say that your partner is living with HIV, but we will not give you.
So wathena uma ungafuni ukuba ne-HIV hlukana nemuntu wakho.
She then proceeded to say that if I do not want to be infected with HIV, then I should break up with my partner.
Oh ngathi mina ngathula ngambuka wasukuma wathena uma kude lokunye ucela kuphuma ahambe kunebantu abanye lekumele abanake lababalekile.
I did not respond to this, and then she continued to say that she would like to leave the room as she has more important people to tend to.
Oh waphuma wangishiya ngihleli lapha nami ngaphuma ngamuka ngidi prep.
She walked out on me, and I still just looked at her, and I did not receive the PrEP at the time.
Dumelang.
Kgotsong. Good day.
I'm Rimas. I'm transgender woman, SW, living with HIV and AIDS. Neke berekisa clinic ya ko Soshanguve Block TT.
I used to use the Soshanguve Block TT clinic.
Okay, fine. It happens hore ke butsi file pila, and then after then bankisa go consultation room.
I successfully opened a file there, and then I was taken to the consultation room.
Then he fihla kamola, and then kakara a male nurse and a doctor.
When I got into the consultation room, there was a doctor and a male nurse.
And then he fihla ka ba botsa hore I was raped, and they were so surprised. After then, care and nurse, I'm botsa hore how do I get raped? Well, I'm a boy. And then I started saying, I have to explain myself that no, I'm transgender woman and I'm SW. So it happens, hori, no, what I'm doing is wrong. Because anal sex is not a place that you can have sex on. So basically, okay, fine then. That's why I get a sex worker, because I'm trans. I need money. That's why I'm living with HIV and AIDS, and then I've never get help since then. So then the guy, that male nurse, I must take off my shirt. And then when I take off my shirt, they see a breast. After seeing the breast, they say, how can you be a boy with a breast? So I have to explain myself that I'm on HRT,
So I have to explain everything. So what I needed now is that the public facilities, they must use, they must have HRT, like produce the HRT for the transgender people, because most of them, like, they don't have any knowledge, they don't have anything. They thought us as trans, we are gay people, we are the same, and we are not. So I've never get help since then, and then I went to Access Chapter 2. That's where I got help with everything. So for me, public facilities for me is not good at all as trans women.
Dumelang.
Good day, everyone.
Ke anonymous from Soshanguve.
I am from Soshanguve.
So there was this other time Sale Kalwala, so I suspected that Kinali an STI infection.
I fell ill this one time and I suspected that I had an STI.
So ka check clinic elmo kaufilena, which is clinic 2 Soshanguve.
The closest clinic to me was Tuso Shanguva, which is the one that I consulted with.
So I decided to utilize the clinic. So yeah, Kabula file, everything went well. Kaya ko consultation, kakra sister.
I managed to open a file and then I went into a consultation room where I met a nurse.
Your sister nali very friendly. Putsisa hore, au si butata ki eng kamotsoro ish. Sister kinali problem momraho, ki suspect or kinali infection.
The nurse was very friendly and then asked what I needed help with. I then advised, and I advised her that I suspected I might have an STI.
So sister aba curious, hori, why onali infection kumrao ulimusati?
I had initially advised the nurse that the area of suspected infection was anally, and then she then proceeded to ask me, why would I have an STI on my anus if I was a woman?
Okay, so I had to explain to Sister Hori, I'm a sex worker and I'm a transgender woman. That's why kirobala na momrao kinali infection. Kisalimo processing ya who change is my surgical procedure.
I then advised the nurse that I am a sex worker and I'm also a trans woman, hence the infection could be found at that area.
So, sister, I was shocked, I was rude from then, since I started to disclose that I'm a sex worker and I'm a transgender woman. I'm putting her why ki ketsa musadi, kisi musadi.
The treatment from the nurse changed immediately. She then continued to ask me why am I pretending or attempting to be a woman whilst I was not one.
So kam answer kara ki musadi, akiketsi musadi ki musadi.
I responded and I told her, I am a woman. I am not pretending to be a woman. I am a woman.
So I was already confused.
She then told me that we like things and we are confused.
Because I needed help, I was in pain. I did not want to argue with her.
Because I needed help at the time, because I was in pain, I did not argue, nor respond any further. I just needed assistance.
So yeah, very sharp. Okay, sharp ka clinic too. Cause bad discriminator, I'm not the first one.
I am not the first member of the key population to be discriminated against, and I feel like I would not go back there.
Yeah, so Aksabatlo Wela, and then what I urge to the Department of Health is that by either desensitization trainings for the healthcare workers, the issues of human sexuality, for them to be equipped with information. Thank you.
I would like to plead with the Department of Health to provide more sensitization training to healthcare workers so that they can be better sensitized on gender issues and sexuality matters. Thank you.
So comrades, just a moment. We've got comrade John Ocheri from Global Fund. He wants to talk to us because in the next 5 minutes, he would like to be excused. So let's just give him 5 minutes, listen to him, and then we will come back to other stories. Over to you, Comrade John. The floor is yours.
Yes.
Hello. Can you hear me?
Yes.
Yes, you can hear me. I put my camera on, but it looks like it's not working, but I think that's fine. So good afternoon, everybody, and all protocols observed. I think I would like, first of all, to introduce myself. My name is John Ochero, from the Global Fund. I am the Senior Fund Portfolio Manager for the Global Fund, overseeing the South Africa grants. Apologies for not being able to be with you physically, because I couldn't make it because of other commitments. But I would like to first of all thank all the presenters for the very clear and succinct presentations made. I also want to thank all the KPs, the key population participants who gave their testimonies. The Global Fund welcomes the third edition of the Ritshidze report on the state of the healthcare for key populations. And I would like to congratulate and thank all partners who have been involved in collecting, organizing, and analyzing the data, which has been able to make this report released. The findings included in this 2024 report constitutes a wealth of community-generated evidence that must and hopefully will be able to guide the way in which key populations programs are designed and implemented. This report, of course, unfortunately, makes some sober reading and underscores the many challenges that the people from the key populations and communities face when accessing, or maybe to even put it, better, when trying to access services, because a lot of them do not actually end up getting the services that they require. I think issues of poor staff attitudes, lack of privacy, limited knowledge, stigma, and lack of availability of services are some of the main barriers that has been highlighted. I don't want to go into the details because you have actually provided the details very, very succinctly. It's very clear that despite the fact that 75% of KPs use public health facilities to get services because they have nowhere else to go, they are not being provided the quality service that they desire. So these findings, of course, speaks to all partners in the response, and it requires our collective action. We need to ensure that all service delivery avenues provide friendly, respectful, and confidential and flexible services to all key populations. And we also need to timely investigate any report of instances where this is not happening. We know that these issues not only affect key populations, but it also affects some of the general population, including the people living with HIV, adolescent girls and young women, and so on, etc., etc. So addressing these challenges is a key step to support service providers in the adoption of new and more positive attitudes and behaviors. Ultimately, the long-term solution is being able to have seamless service provision in all service provision points, including health facilities for all populations, but recognizing that there are some specialized services that we will need to still continue having in safe spaces, such as drop-in centers and mobile clinics for some key populations. So giving communities, and in particular the most marginalized communities, the ability to be able to monitor the quality and quantity of service provision is very, very critical. This is in line with people-centered health service delivery, so that the issues or problems or challenges that are experienced can be highlighted and corrected collectively, and so that we can be able to have improvement in our health services. As I think you all know, the Global Fund is fully supportive. We are supporting community-led monitoring as a preferred option to collaboratively address barriers and to improve the quality of health services. In particular, we are following the Ritshidze model. We are happy, and we especially are focusing on the key and vulnerable populations to identify and monitor local barriers and to advocate for improved quality, accessibility, and affordability of services in the community settings, as well as in the facilities. We also do have a human rights breaking down barriers to health service provision program, and we've worked very closely with the civil society, with SANAC, with NDOH, with PEPFAR, and other stakeholders to ensure that we're aligned. So for us, the existence of the Ritshidze and the other CLM mechanisms is a wealth for the country, but it also calls for greater coordination so that the community-led monitoring generated data can be used well for decision making and advocacy and in engagement with the duty bearers to bring about change. We need to ensure that this information that we have gathered is not put on the shelf. It is used to be able to generate change in the direction that is positive. We hope that the Global Fund investments in the country will also help to build this process. I think I would like to end on a note of suggesting and saying one potential solution would be for a policy to be put in place or some kind of policy to be put where health facilities put in place health committees that includes community leaders, key populations, and members of people living with HIV and key population representatives on that committee that could potentially meet on a monthly basis to review what the feedback is from the communities that are using the facilities, and also to positively work on improving the services collectively. That might be able to help generate some kind of change and understanding, because if community members are involved in making decisions for their health facilities in their communities, it might help really moving forward. Yeah. So I think I would like to end here, and I just want to wish you all the best. We look forward to a state where all key populations can access health services without stigma or fear of discriminations. Thank you, and I would like to hand the chair back to the chair. Thank you.
Thank you, Comrade John. Thank you very much. Comrades, we may proceed.
Good day, everyone. I'd love to remain anonymous. I'm come from Gauteng province. Khona lelanga enjaya ngayo e public clinic.
There was a day that I used the public facility.
Ngiyofuna usizo mayelana ne hormonal therapy.
I needed assistance in terms of hormonal replacement therapy.
Yeah, ndaya khona along the way ngidlula ama security gate.
All right, I got to the facility and then passed the guards at the gate.
Baqale baqhwebana ama security ngazi for words mhlambe bebadidekile ukuba kwenzakalani. They didn't understand ukuthi kwenzakalani ngesexuality yami.
They started reacting to my presence being there. I suppose they were quite unsure of my sexuality.
Okay, ndigqithe ndiphase ndiye phaya phambili la kubhaliswa khona amakhadi. Mfumane enye like ndibuza ukuba sanibani njani. Do you offer ama hormonal therapy?
I then proceeded to get a file opened, and then I met with the clerk there, of which I asked whether they provide hormone replacement therapy.
It like yandibuza ukuba ndingumfana okanye ndintombazane.
The clerk then asked whether I was a boy or whether I was a girl.
Ngendlela ukubonisa ukuba yambona ukuba wenza jokes, trying to make fun of me.
In a very derogatory manner.
Yeah, after that, angiphendule ngambuza bayi nayo na hormones but intoni leyo.
I did not respond. I then proceeded with the matter that I was there for. I asked whether they have hormone replacement therapy. They then asked me what that was.
Ndahluleka ukuphendula ndamshiya apho ukubuyela ekhaya. Then another day ndabuyela futhi ndiyofuna lubricant because I was running out of lubricants.
I was unable to respond to her. I then just went back home without receiving any assistance. I went back another day in search of lubricants.
They don't offer lubricants for homosexual. I might as well go somewhere or do what's
I was advised that they do not provide lubricants for members of the LGBTQIA plus community. I should rather go purchase them.
Yeah,
it was quite evident that she just wanted to be done with serving me.
Okay, ndimshiye apho xa ndiphuma ndithi ndiyagoduka ndihlangabezane isecurity futhi andimise angibuza ukuthi umfana noma intombazane ndithanda intombazane athi manje waye unganamabele.
when I was leaving the facility, the security guard then proceeded to ask me whether I was a boy or a girl. I then responded that I was female, and then he asked, why do I not have breasts then?
Baqhwabana ngami, you know, bakhuluma lezi zinto behind my back, and that thing ayizange indiphathe kahle. Because I feel like soze ngiphinde ndizapha because I don't feel safe at all. It's stuff sakhona nje. See, unfriendly towards I'm a homosexual.
They then continued with very derogatory sneers at me. They kept on laughing, so much so that I told myself that I would not go back to the facility as I feel unsafe there.
Thank you.
Thank you.
We will now go to look at the contraceptives. Contraceptives are also not always made available to members of the key populations. In this reporting period, only 65% of sex workers, 64% of trans people, and 63% of people who are using drugs reported being able to access the contraceptives that they wanted. This is worse than our 2022 results, when 75% of sex workers, 72% of trans people, and 64% of people who are using drugs reported being able to get contraceptives that they wanted. Alarmingly, of those who were unable to get contraceptives, 32% responded they were denied them because they were just sex workers, 34% were denied them because they were trans people, and 46% were denied them because they were people who were using drugs. Other reasons for not getting these contraceptives they wanted were due to stock outs. They were just not available. Their first choice being unavailable or being told to come back another time. Now we are continuing with the recorded stories.
They give us general services, but we don't get contraceptives. They say we cannot fall pregnant while smoking nyaope.
Trans people are discriminated against at the clinic. They call you by wrong names. You cannot access hormones there. And if you need contraception, they would ask you to go bring evidence of menstruation.
Next, we will look at post-violence services. It is critical that public health facilities provide safe and caring post-violence services, especially in the context of an epidemic of gender-based violence, abuse faced by sex workers at the hands of clients or partners, and attacks of queer and trans people. Yet, in this reporting period, only 52% of gay, bisexual, and other men who have sex with men, 52% of trans people, and 50% of sex workers, staff were well trained to care for those who experience violence. Further, only 40% of gay, bisexual, and other men who have sex with men, 31% of sex workers, and 31% of trans people said staff were respectful. It means after violence, people are faced with the secondary trauma and indignity of trying to access post-violence services. Concerningly, among those who needed services, only 56% of gay, bisexual, and other men who have sex with men, 56% of trans people, and 47% of sex workers were able to access them. This is dramatically worse than our 22 results, when 94% of trans people, 83% of gay, bisexual, and other men who have sex with men, and 71% of sex workers reported being able to access services. People should be able to receive services such as rapid HIV testing, PEP, STI treatment, emergency contraceptive, completed J88 forms, rape kits, counseling, and referral to domestic violence shelters. Most commonly, people reported that counseling was unavailable, followed by STI services, PEP, and rapid HIV testing. Another critical service is the completion of a J88 form that records medical evidence that may be needed in order to obtain a conviction in an assault case. Sorry. It is the most important evidence that an assault or rape occurred. You can open a case without one. You cannot open a case without one. However, of 22 gay, bisexual, and other men who have sex with men we spoke to that tried to access a J88 form, 13 were told to come back and 6 were denied on the basis of being a gay, bisexual, and other men who have sex with men. Of 50 sex workers we spoke to that tried to access a J88 form, 21 were told to come back and 9 were denied on the basis of being a sex worker. Of the 20 trans people we spoke to tried to access J88 form, 10 were told to come back and 2 were denied on the basis of being a trans. We move to our community members who have joined us today.
Molweni nonke. Igama lam nguNosicelo ndisuka Eastern Cape.
Good day, I am from the Eastern Cape.
Yeah, into ibinzisa apha namhlanje ndicela uthetha ngestory sam.
I would like to share my story with you today.
Bendiye ekliniki, eGombo Clinic.
I went and consulted at Gomo Clinic.
Yes, bendochaza phayana ndandirayichiwe phayana ufika kwam.
I went to report there as I was sexually violated.
Then ke ngoku ndadibana ne-security egeyithini andibuza uba yintoni ingxaki yam.
I then met the security guard at the gate who asked what the problem was.
So ndazama ke ngoku umcacisela uba kwenzeke ntoni.
I tried to relate the story to the guard.
But bekufani kum ngendlela aresponde ngayo kum uba ureyitshwa njani ungumntu ozenza indoda kodwa uthi indoda but still uthi ureyitshiwe.
The guard then said to me, you're a person who pretends to be a man. How is it that you are then sexually violated?
So ke ngoku nathi ndiyacela torho andifuni uthetha kakhulu because ndicela udibana nogqirha ngaphakathi.
I advise that I do not want to further get into it. May I please see a doctor?
Then waqhubekeka ke mane insult ethetha wrong ngokumba nifanele ureyitshwa nani manizenza amadoda, and then at the same time nina nithatha amantombazana wethu ukuba nizenza amadoda.
The guard then continued insulting me, saying that you deserve to be raped because you pretend to be who you are not, and you also take our females from us.
So ndathi kuye andikwazi ukuphendula bhuti, so ndicela udibana nogqirha ngaphakathi.
I responded that I will not be responding to those comments. May I please see a doctor inside?
So wandisa ke ngaphakathi wabiza lo sister ke obe phayana busy phayana wathi nango lo sisi bhuti angazi uba ndizambiza njani because uthi ureyitshiwe so uzozama ureporta apha kuna apha ekliniki ukuba nimncede.
The guard escorted me inside, and when I got to reception, continued to use derogatory terms against me, also relaying my story that this person has come to report a sexual violence case.
So ngoku ndathetha naye lo sister phayana wabebuza imibuzo kuba bendiphi kuze nereyitshwe, so ndiyamcacisela ke ngokuba no mna bendibuya kwitshomi yam later on. So ngoku ndadibana lo mfana wabenditsalatsala ndibetha wabekusela wente wandireyipha.
I was then asked by the clerk what had happened or where I was when I was violated. I advised that no, I'd gone visiting with a friend, and on my way back, I met a male person who then continued to sexually assault me.
So ndithi ke ndicela nincede ke because ke le nto yenzeke ebusuku phezolo, so njengoba bendisiza apha kuni kusasa because ndicela uncedo.
I advised that I need urgent help as this had happened the previous night, and I came in the morning for me to receive assistance.
Wathi ke nakakazokwazi unceda into nazave sandincede yona awave sandinike iipilisi ikhona enye igama libizileyana JBP loo form besithi uzandinika yona but ayikho phayana, so mandihambe ndiye epolice station but angandinika yona ipilisi yepains.
She then advised that there's not much that she can do for me. She can give me pain tablets. There is a J88 form that needs to be completed. However, they do not have it. I would need to go to the police station for it to be completed.
So ngenxa yomsindo nam ke ngoku because indlela ndiye bathetha ngalo kum whereby nam ndize ucela uncedo kubo as umuntu obereyitshiwe. So ndaphuma ke mna ke nathi no it's fine if andikwazi usinceda. So ndabuza umbuzo ke mna ke kuye, what if ubungusister wakho lo kwenzeke le nto kuwe? okanye ngumntana wakho so buzawufila njani. Wathi hayi wethu sesifundwesishela ixesha ndicela uhambe police station.
I felt extremely defeated. I then asked one question. I asked, how would you feel if this could have been your child or your sister who had gone through this experience? I was then told not to waste time and I should just go to the police station for that J88 form.
So mna ndendaya endlini because ndandikhathazeke nyhani. Then ndaqomba andizokwazi nothetha nase-police station because sendicinga ke ngoku napha e-police station bazawuthetha the same story because namapolisa sometimes bayathanda uthetha izinto ezinjena kuthi. Uba kakade ndibe ndivele ndireyitshwe noreyitshwa because ndihlele ndizenza amadoda kakade.
I felt very defeated. And I felt that I couldn't even go to the police station because most probably they would say the same thing or receive the same treatment that I received at the clinic, saying that I am pretending to be who I am not, hence what happened to me happened.
So ke ndaya endlini andathetha kumama wam ndathula but ke ndafika ndahlamba then ke ngoku ngengomso ndadicide okay mandihambe ndiyozama i-pregnancy test ndihamba ndoyithenga ndazizama uzithesta. So ndafumana okay eyona nto ibindistress uba okay ingathi kane ndimithe so ndandapha okay andikho-mithe ndi-negative. Kukho abanesi bathanda uba sesitratweni abaneekhonteyini bamane besixelela uba masitheste igazi. Ndathesta naphayana kubo ndifuna uzijonga uba andina-AIDS na okanye infection so nalapho ndathesta negative.
Okay. I then proceeded to try to resolve the matter myself. I first tried to get a hold of a pregnancy test, of which that came out negative. However, there's also nurses who do voluntary testing close to my area. I then went to them to find out if I was living, well, if I had been infected or anything. Those tests also came out negative.
So ke ngoku elilonke kum endizawuzama ulithetha asikho safe naxa siya ezikliniki okanye ezipolice station sochaza iimeko zethu uba sireyitshe okanye ubethu uhlatyiwe. So abakwazi usinceda bona, instead bona into abayenzayo basiphosa amagama arong. Sisibhuti, lesbian, loo nto iyo ayisuka khawusuka apha ecam kwethu. Into ezininzi nje abazithethayo kuthi so asifili comfortable sihambe siye kubo. So kuthi phofu kum is better vese ndihlale ndizama uzinceda ngokwam.
We do not feel safe at all. We do not feel safe accessing public health facilities. We do not feel safe going to the police station. Instead of receiving help with care, we are rather discriminated against or derogatory words used against us. That is why most of the time we just attempt to solve matters ourselves and self-medicate as far as we can. Thank you.
They said to me they don't believe me. That we gays like to sleep around. I was showing them all the bruises, cuts, and I was bleeding. I asked them if this is how I should look if it was consensual sex. One of them said just give him antibiotics so he can just go, as we are not buying anything he's saying. I had to heal on my own. Even my family did not believe me. The people at the clinic did not believe me. Then who do I go to?
I was raped and I went to the facility to get help. I explained to them that the men broke into my place of work and gang raped me. The staff know I'm a sex worker and said I deserve to be raped as I was corrupting their children in the community because of my behavior. I did not get any services or even a J88 so I can open a case at the police station.
I stopped going to Kwamsani Clinic because of the bad treatment that I received. After a sexual assault, I went there to report what happened and I never received any medical assistance. The nurses laughed at me saying, "How can you say a man raped you when you are also a man? Don't joke around." So I went home without getting any services for sexual violence like HIV testing or post-exposure prophylaxis. I found out months later that I was living with HIV. This might have been prevented if I was assisted during the incident that I reported at the clinic.
Next, we will compare service availability at drop-in centers and mobile clinics. Lubricants are far more commonly found at both drop-in centers and mobile clinics compared to the facilities. 82% of gay, bisexual, and other men who have sex with men, 86% of people who use drugs, 91% of trans people, and 93% of sex workers reported that they could always get lubricants at the drop-in center, double the percentage of people reporting that they could get them at the facility. Compared to drop-in center, more gay, bisexual, and other men who have sex with men reported that they could always get lubricants at the mobile clinic. Though marginally fewer trans people and far fewer sex workers and people who use drugs could always get them at the mobile clinic than the drop-in center, efforts should be made to ensure that everyone can get enough lubricants each time they go to the drop-in center or mobile clinic. Drop-in centers and mobile clinics could be offering PrEP to everyone not living with HIV. However, they only performed marginally better than facilities did. At drop-in centers, just 50% of gay, bisexual, and other men who have sex with men, 44% of trans people, 40% of sex workers, and 35% of people who use drugs were offered PrEP. At mobile clinics, only 42% of gay, bisexual, and other men who have sex with men, 40% of trans people, 36% of sex workers, and 27% of people who use drugs were offered PrEP. This is a missed opportunity at sites specifically meant for members of the key population. The availability of PEP also varies across population group. At drop-in centers, while 86% of sex workers reported being always able to get PEP, only 39% of gay, bisexual, and other men who have sex with men, and 32% of trans people said they could do the same. Most commonly, stockouts were reported as the main reason for PEP being unavailable. At mobile clinics, while 90% of gay, bisexual, and other men who have sex with men said they could get PEP, only 62% of people who use drugs and 55% of trans people could say the same. Again, stockouts were reported as the common reasons why PEP was unavailable. Although, additionally, among sex workers, responses, some people were told that they asked for it too often, or were told that it was not meant for sex workers. STI screening services were widely available at drop-in centers and mobile clinic, with a majority of people reporting being always able to get screened. The majority of drop-in center and mobile clinic staff were also reported as being respectful when people asked to be screened. Most people, although not all, were able to access treatment if needed, but both at drop-in centers and mobile clinics. For those unable to access treatment, stockouts were again the most common reasons given at both drop-in centers and mobile clinics. Positively, 87% of people who wanted access to new needles were able to get them at the drop-in center, and 74% could get them from the mobile clinic. For those not able to get new needles, the most common reasons given were due to stockout, followed by being told they asked for too many, or that the drop-in center does not offer them. 77% of people who use drugs, who use drop-in centers, were always able to get methadone. For those who were not able to, the main reasons provided were that it was not provided at the drop-in center or they were out of stock. Only 51% of people reported being given information about where they could get methadone at the mobile clinic. Positively, 95% of trans people reported that staff were respectful of people's gender identity at drop-in centers, though only 79% of trans people said the same for staff at mobile clinics. 95% of trans people using drop-in centers wanted access to hormone therapy at the drop-in center that they use. 85% had asked staff where they could get hormones. 21% were able to access hormones at the drop-in center itself, and 67% were referred to another facility. 47% of trans people using mobile clinic had asked mobile clinic staff where they could get hormones. 66% were referred to another facility, and 28% were told that they could pay a doctor for referral. A higher percentage of people thought the staff were well trained to care for people who had experienced violence from a sexual partner at drop-in centers and mobile clinics compared to at facilities. Also, a higher percentage of people also thought drop-in centers and mobile clinic staff were well trained to care for people who had faced violence from a sexual partner than at facilities, although there is still room for improvement, particularly at mobile clinics. On the whole, a higher percentage of people were able to access these services, except that only 59% of gay, bisexual, and other men who have sex with men reported being able to access post-violence services at the drop-in center. Concerning our centers of excellence, to function effectively, centers of excellence must offer the clinical services and expertise that members of the key population need. A minimum package of services as outlined fully in our report must be made available, including HIV testing and treatment and prevention services, STI screening and treatment services, sexual and reproductive health services, post-violence services, TB services, hepatitis vaccination, testing and treatment, and all other primary health services. Clinicians must understand that the health needs of trans and gender diverse people and be able to offer appropriate services include hormone therapy. Harm reduction services should also be available for all members of the key populations who use drugs, such as new syringe and needles, and safe spaces to dispose of used needles and syringes or other injecting equipment, and overdose treatment and methadone.
Thank you. We are almost done, comrades. But I'm sure all of us here, more especially colleagues from the National Department of Health, PEPFAR, CDC, USAID, Global Fund, UNAIDS, now, and as well as district support partners. Now, I'm sure we know why South Africa is unable to meet the 95, 95, 95 global targets. We know. And I'm sure as we go to the boardrooms, we need to change some strategies and the way we do things so that we do not end up listening to the stories and testimonies that are given by the people here as one of those talk shows. Something must be done. These are not just issues of people who are being denied healthcare services. These are issues of indignity, injustice, and violation of human rights. I know and I'm aware that all 8 provinces of TAC and the 32 districts, comrades, are watching this live in numbers. And I am not only talking to the people who are in the room, I'm talking to everyone online as well as comrades in the districts of TAC. My first appeal is to the Ritshidze team. We need the contact numbers of all these comrades according to their districts and provinces, so that they can be given to the national organizer as well as TAC provincial managers. In order for TAC district coordinators, those who are coming from the same district, we can put them together and see Ukuti, how do we move forward. Comrades, there is no, all the rights that we are enjoying today, be it in South Africa or outside South Africa, even in the US, all the rights that people are enjoying today never came on a silver platter. A right to vote in South Africa, people were killed, they were arrested, they were tortured in order for them to enjoy it. And it cannot be true that in order for our rights to dignity, to justice, we are going to fold arms and think that someone is going to fight for us. So, one of the things that we need to work together in making sure that it is happening on the ground is that any injustice to one community member must be an injustice to all community members. Now we need to leave the slogan which says an injury to one is an injury to all. Let's go back to our communities, to our districts, to our provinces, and look for TAC branches. Because we cannot leave these cases of injustice unattended. We need to go back to these clinics, comrades, where our rights were violated either by the nurses, by the cleaners, by the security guards. We need to identify these people so that we can take up these issues with facility managers and district health managers so that we can see what are they going to do. What I'm expecting, even if something happened last year, I'm expecting us to go back to these clinics and say, on this date, I came to this clinic. This one said this and this and this to me, and as a result of that, I don't feel comfortable to come back to this clinic again. And you cannot do that alone without TAC branches joining you in terms of organizing and mobilizing on the ground, so that when you go to these clinics, you don't go alone. Then if these facility managers and district chief directors are not doing anything about that, that's where our campaigns must start. If it means we must make these security guards, these cleaners, these nurses to trend on social media and apply other means in order for them to be removed in these facilities, let it be. We cannot afford a situation, comrades, where we will allow these people to get away with murder because we do not want to look like we are attention seekers. Anything about our health, anything about our lives, anything about our rights, if it means we must be attention seekers, let us be attention seekers in standing up and fighting for our rights. If we allow them to continue to do this, we must know that we are failing the generation of Chrisani. We must know that we are failing the generation of Stephen Bandubiko. You must know that you are failing the generation of Mangaliso Sobukwe. You must know that you are failing the generation of Solomon Mashangu. These are the people who fought for our rights. And if we do not stand up and fight for our rights, generations that will come after us will blame us for betraying them. They will blame us for betraying them. So, the TAC branches must work with you. Ritshidze must give us your contact numbers, and we will add your issues on issues that other public healthcare users are experiencing in our clinics. Comrades, the time has come now for us to stand up. This thing, when you are in a clinic, one person's right is violated and you are folding up your arms, is a sellout position. When someone's right is violated in a clinic, you must stand up and defend that individual. Because if we do not do that, they will continue to violate our rights. They will continue to make us not to go to clinics. Yet they know that when them and their families are sick, they will go to private healthcare services. We must stand up, comrades. We must stand up and fight for our rights. Our right to access healthcare services, it is within the Constitution. These nurses are not doing us any favor. When we go to the clinics, we don't go there to ask for a favor. We are going there to access healthcare services because it is within our rights. If it means that on that particular day, a clinic must be closed and people not get services until you are attended to, let it be. We cannot, comrades, we cannot allow ourselves to die in silence because we are scared of confronting these nurses who are violating our rights. We need to roll up our sleeves now. We need to wear techies and tracksuits so that when we go to clinics, we know that anything is possible. When I say anything is possible, I do not mean we must manhandle nurses. No, we must go there and demand our rights to be respected. We need only one nurse, one cleaner, one security guard to make an example about them. And others will learn from that one. So, let us not be complacent, comrades. Let us use our anger. Let us use what we have experienced in these facilities to make sure that it ends with us. We must make sure that it ends with us. And TAC branches, TAC provincial leaders who are watching this, we must know that if we are not doing anything about these issues and other issues that affects our communities, we have failed the generation. We have failed the generation. I am not sitting here to be a failure, because one day when I'm dead, I need to answer in heaven what I have done for the humankind. The only thing that we can do for humankind is to stand up and defend the rights of the people. We will die a happy death. So I'm going to the recommendation, comrades. Services specific to the needs of the people who use drugs, sex workers, and LGBTQIA+ communities must be made available in public health facilities, beginning with the expansion of COE model. A minimum package of services, as outlined in Appendix 1, must be made available at facilities serving as centers of excellence, as well as drop-in centers, so that they can provide comprehensive health services to people who use drugs, sex workers, and LGBTQIA+ communities. PEPFAR must commit additional resources to make this a reality. HIV prevention tools, including lubricants, external and internal condoms, PrEP and PEP, must be easily available at all public health facilities. Condoms and lubricants should be available in a range of spaces across the facility, including but not limited in the toilets, at the gate, in quiet areas, out of sight, so people can freely and easily collect them without fear of judgment. PrEP should be offered to all members of key population who are not living with HIV or test negative for HIV, with information shared on its benefits. PrEP posters to be distributed and put up in all facilities informing people about PrEP. PrEP information to be provided in daily health talks. People who use drugs must be able to access life-saving harm reduction tools like new needles, syringes, safe disposal of injecting equipment, methadone, naloxone, and drug-dependent support close to home. Harm reduction services must also be made available to sex workers and LGBTQIA+ community members who use drugs. Methadone programs should be made available in public health facilities, beginning with the expansion of centers of excellence. The Department of Health should social contract this work to organizations competent in providing these services already. National Department of Health guidelines and policies should be amended to ensure that naloxone is not only nurse-initiated but can be initiated by community members themselves. Clinicians must understand the health needs of trans and gender diverse people and be able to offer appropriate services, e.g., appropriate sexual and reproductive health services or cancer screening. All facilities must provide gender-affirming services, including using trans people's correct name and pronouns, providing a gender-neutral toilet for trans people, removing colored folders that mark people's gender, ensuring that trans women are not made to use service point for men, including men corners, or men-only clinic days, protecting privacy by ensuring that additional staff members are not called into consultation rooms and that staff knock before entering, allowing consultations to pause until the person has vacated the room. National Department of Health guidelines and policies must be amended to ensure that trans people are able to access hormone therapy from doctors in public health facilities locally. Centers of excellence must have access to medical support, network, mentorship, and telesupport to assist in consultations on the use of hormone therapy for trans people. That brings us to the end of our report. And now I do not know whether the Deputy Minister of Health, Dr. Sibongiseni Dlomo, is still online, or anyone from the National Department of Health. Can we confirm is there any one of them who is online? Can we invite them for a few minutes to come and talk to us? Whilst they are talking to us, one of the things that we did, colleagues, are these testimonies. These testimonies are stories of people in this room and other people who are not in this room, which I would like each one of you to have them. Can you distribute them, Comrade James? I would like each one of you to have them. Unfortunately, because of confidentiality, we didn't mention names of the people. But what is important are stories of what the people have experienced. So it seems as if there is no one, or ukhona usisi Regina from the NDOH. We will hand over to Regina. Over to you, Sis Regina. Where is Sis Regina?
Good day, colleagues.
Amandla, Sis Regina.
Amandla. Yeah, as a Department of Health, we've had this report, and we will make sure that our senior managers they get this report, especially on the issues of policy, because we already know that a policy, it requires the senior managers. So we will make sure that we give this report so that we can fast track whatever that is needed. And then in terms of other interventions, already there are issues that are already taking place at our facility level, at our district level, and also at our community level. We are having the peer educators. The peer educators, they are at the community, but their main purpose is to recruit and ensure that they navigate the key population to the facilities. And then, as you remember previously, we used to have we used to appoint peer educators that were not necessarily the peer educators, but now we are encouraging the department to appoint the peer educators, actually the key population peer educators. The process is slow, but we are monitoring our business plans to ensure that we appoint specific key population peer educators. And then in terms of the sensitization, because based on everything that has been said today is about sensitization of our healthcare workers, we are going to make sure that we intensify our training. We make sure that, because at the moment, we are being assisted by CDC and PEPFAR to review our current key population sensitization manual. And then once that is been finalized, then we will continue to train to make sure that even the facilities, they are having the online training. And then we will also make sure that everybody, the clinicians, the doctors, the nurses, they are offered training through our knowledge hub, because the department, it is having the knowledge hub. So we will ensure that not only the clinicians are trained, but we also want to make sure that our managers from different departments are also being capacitated regarding management of key populations in our facilities. And then the other thing, in terms of key population friendly facilities, we will continue to advocate for extra resources, as you have mentioned, that our partners, they need to support us. We are also asking that we be supported, because as you know that currently we are having a budget constraint, but that does not stop us from looking elsewhere to make sure that there are services that are continuing. And then we will also make sure that we engage our clinic committees, because remember that our clinic committees, they are there as members of the community, and also being in our public health care facilities. We will make sure again that because I've heard a lot that has been said about the hospitals not being friendly. So we will also make sure that wherever there are clinic committees, we should also engage with the hospital board, so that we are having these discussions and we are having an improvement in our deliberation of our key population in our country. So right now, I have just been engaging our sorry, there was a call that I was waiting for. I was just engaging with our mental health. So we said that we need the mental health support, and then they have committed to ensuring that there will be mental health support, and then they are also working closely with DSD for psychosocial support. And then I've also noted your recommendation with regard to the naloxone, the methadone, so that it will also be taken further to mental health to make sure that they are on board, and then they assist us in making sure that we offer the services and the treatment that is necessary to reduce the burden. So I think I've said that we are committed as the Department of Health. That is why we are supporting the Centers of Service Excellence, and not only that, we are also having vets on board to support with mentoring and coaching on site. So we are committed to make sure that we improve. So be with us and go with us as we are still on this long journey, but we will make sure that that is considered. Thank you very much.
Thank you, Sis Regina, and we are glad to hear everything that you have said. And as I'm calling CDC, comrade Sis Regina, you must tell the Minister of Health, you must tell Cyril Ramaphosa, so that he can tell the cabinet. As TAC, we are sick and tired of the rights of the people to be violated. As from today, we are giving instruction to people across the country to make sure that if their rights are violated in our clinics, we will defend ourselves by all means necessary, because we are tired of being stigmatized. We are tired of being discriminated. The time has come now for us to defend ourselves. You have been wasting a lot of time sensitizing, training people, but we do not see any positive results on the ground. We will assist you to make sure that we sensitize our healthcare workers in our facilities. When we do that, don't blame us. Blame it on them. Thank you. Over to you, CDC.
Thank you. Thanks so much, Anele. And I must say, I'm also truly... I'm truly appalled at a lot of the stories that I read in your report and that I've heard from. And I hear these stories over and over again. And one thing you do say in your report is this not? Oh, that's better. One thing you do say in your report is drop-in centres are not the answer. We know that. We need to make a health system, we need to create a health system that's strong and sensitive to the needs of all key populations. And this is what we are trying to do, very slowly. But what we do appreciate about Ritshidze is that you show us where the gaps are. So I read with interest transgender men being refused contraceptives. Really horrific story there. We will ensure, as Mayor Regina said, we are revising our sensitization manual. We will ensure that there are guidelines in our sensitization manual and also job aids on how to assess reproductive services for people like transgender women, women who inject drugs. These are all very marginalized populations. I think there are two things that I want to bring up. There are no, it's fine. There are two things that I want to focus on today. The one is evidence, and the other one is advocacy. I think PEPFAR through CDC is good at gathering evidence. For example, we did a pilot study rolling out viral hepatitis screening, testing, and treatment in one prison in the Western Cape. It went so well that we're beginning to roll out in other areas. And in Westville, we're starting harm reduction services in Westville Correctional Centre. So this is the evidence. We gather evidence, we show people, we show the Department of Health that this is effective, like syringes, clean needles and syringes. These are important. I think the other element is advocacy. This is something that PEPFAR can do on a smaller level. Methadone, for instance, we now have, instead of one sole supplier, we have 4 suppliers of methadone, which brings the price down and helps us get more people onto methadone. This is something that we continue to push. But we also ask Ritshidze for help. We ask Ritshidze for help on getting access to gender-affirming hormones, to making sure that methadone is available in all clinics. And I think through collaboration, we can work together. Just finally, I do want to say we are working on the Centres of Excellence slowly, but and we do take Ritshidze's advice. And every meeting that I go to, we add on to what we're doing. We add on to our sensitization manual. We add on to people working in public health clinics. It's not easy, but we're trying our best, and we do hope. And I want to acknowledge Tatu Fararai, who has actually led this process for us very effectively, working with the National Department of Health. So thank you all once again for your amazing stories. And believe me, I do also believe, and I strongly stand right behind Comrade Anele in health equity for everyone. So thanks all.
Thank you very much, CDC. And we hope that as we are working together, we will also work together in making sure that we hold district support partners accountable. Because there is no way that all these things will happen under their watch and they don't do anything about it. If it means that you must withdraw your funding from them, let it be. Because at the end of the day, it is not about them, it is about the people. So we will call upon US Aid. Is US Aid here? Going once, going twice. US Aid is not here. A Global Fund is done. Is Office of the Health Standards available? I serve in that office as a board member. I serve there. I bang tables there. So, in the absence of the Office of the Health Standards Compliance, I will call upon the comrades from UNAIDS to come forward and address us.
Good afternoon, everyone, and I stand on existing protocol. So, my brothers, my sisters, some of you are my daughters. I look young, but I'm old. Some of you are my daughters, and some of you are my sons. So, all of you are beautiful and brave. Very, very beautiful and brave. Thank you for your courage. Thank you for your courage and your willingness to share your stories. It's not easy, and I could see a lot of you were getting triggered and crying, and I saw some fluttering eyelashes, beautiful eyelashes. And some of them were really fluttering as others were telling their stories. And yes, I'm looking at the lady in the dress with the pink hearts. So thank you for inviting us, Ritshidze, for inviting us to this space, into this dialogue. I'm always amazed by the richness of the data that is presented at these dialogues. And this data compels us to action. It really compels us to action. It reminds us that behind their data, there are people. It's not just data. There are people, and your testimonies and your stories, your powerful, heart-wrenching stories, really continue to remind us of that. So thank you, Ritshidze, for that. This data compels all of us, including the government, to be part of the solution. And UNAIDS, we continue to stand with you. We are committed to work with you and all the partners to carry forward the recommendations that you've put up. I was very, I was angry. I was angry by the words that I heard today. I was really angry by some of the words. Umagosha. Umagosha. Para. Peto. Noganyindoda. I was really angry by these words. I'm not South African, so I'm sorry for the pronunciation. But it reminded me of something my executive director said last week. Mama Winnie Byanyima, who met Anele, she says she sees HIV from the lens of injustice. So it's not just a disease, it's an injustice. It's an injustice. It's an injustice because why is anyone getting affected in this day and age? Right? There's all sorts of prevention tools out there. PrEP, PEP, condoms, lubricants. So when you see new infections and people getting infected, it's an injustice. There's no reason why people are dying when there's treatment. It's because of injustices. So tomorrow, if some of you do not know, is 1st of March, and it is Zero Discrimination Day globally. It's a day that we established 10 years ago as UNAIDS to protect the rights of everyone. And this year's theme is protect everyone's health. To protect everyone's health, we need to protect everyone's human rights. Anele, my comrade, my Secretary General, comrades in this tent, I felt like I was getting a beautiful treatment with all the heat. You know, it was like being in a steam room, right? I saw some people were fanning themselves. I just felt happy to be in Africa and in the warmth, because our colleagues in Europe are freezing. We must dismantle stigma and discrimination. The indignity that you all face, the humiliation, the pain, the violations of your privacy and your confidentiality, the maltreatment. I don't know what a security guard is doing asking you questions when you get to the clinic. Can you invite me to one of these clinics so I can go there early in the morning and meet these security guards who ask all these questions? You know? I'd like to see the job description where they are required to be asking all these questions. And I'm really impressed that you're answering. I would say no. I'm not talking to you. Your job is to open the gate and guard, and that's it. So I'm really impressed that you stop to talk and explain. But I know that it's sometimes because you don't receive what you need inside. So you look for allies anywhere you can. So as Anele said, when people are giving up on treatment, we are losing our gains. And we've made so many gains in this country. You know, we have more than 5.6 million people on treatment. We cannot lose those victories, those hard-won, hard-fought-for victories. So we will stand with you, and I am who I am because of who we all are, right? You all have a right to health. The Ritshidze program is an amazing program. You are highlighting all of this information. It is taking us to task. And let me tell you, what you do in South Africa, everybody admires you across Africa. And everybody wants to come here and learn. We just received a request from Rwanda, Secretary General, for them to come here and learn about Ritshidze. You are motivating everybody. You motivate me. You make me wake up in the morning and want to come to work, because behind the data, in front of the data, are people. And you are all beautiful. All of you. Thank you.
Thank you, Comrade Eva. As we are closing, comrades, I'm talking to you now. All of you today, what is the time today? My watch is saying 15:52. Today, as you walk out of this hall, you are all TAC members. You are all members of TAC Key Population Sector. I've got to Comrade Philemon here, the National KP Sector Leader. I would like him to address you for 2 minutes. Me and him, we've got a responsibility to take up the struggles of the key population and people living with HIV in South Africa. I want him to talk to you so that if he is going to fail you, I am not going to fail you. Comrade Philemon, over to you.
Baba kupila babantu emzabalazwe emzabalazweni 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 bebe kupila babantu emzabalazwe bebe kupila babantu emzabalazwe emzabalazweni emzabalazweni. I'm speechless. I feel like crying. I'm so emotional, but I had to be strong. I must be strong. My General Secretary Anele says we are going to take our heads to a block to say we are going to die for you guys. We are here today as TAC Treatment Action Campaign to save lives. We are not here for being the flowers or the tree that are not bearing anything or that are not doing anything. We are here for you, leaders. We are here for you. I would like to thank Ritshidze to be here for us. I heard all the stories. I am emotional. I was asking myself questions. The difficulties that we are in now, I think that we are going to work together so that we must get rid of those things who are happening to our health facilities. Even the stigma and the discriminations that are within our communities, we should work together. Let's fight this together. So I'm not happy, I'm angry, but I'm strong because of you guys, because you stand firm and fight for yourself. So now we are going to fight together. I'm not going to fail my GS. I'm going to work very hard. Thank you for Ritshidze, thank you for Ndi, Loti, and all the people who are, and Moses. And Moses, I'm saying struggle still continue. Let's work together and hold this button, baiting to go forward. Thank you very much.
Thank you, comrades. Comrades, I without wasting your time, the only thing that I will never do is to say things that I do not mean. I will never die for you. I will die with you. I will never die for you. And I will never be arrested for you. I will be arrested with you. Let's go together out of this wall, go to our communities, organize other people who are like us, and say, now the time has come for us to use our anger to fight these people. In that note, I thank you all, and the meeting is adjourned. Thank you.
Good luck. You need to go sleep.